From Kern Government Television, welcome to this week's Kern County Board of Supervisors meeting, originating from the County Administrative Center located at 1115 Truxtun Avenue, Bakersfield, California. Kern County's vision is to create and maintain a customer-centered county government designed to garner the confidence, support, and trust of the people we serve. Today's Kern County Board of Supervisors meeting will convene momentarily.
Thank you. Board to reconvene. Madam Clerk, good morning to you. Would you please call the roll?
Supervisor Gleason.
Here.
Supervisor Scribner.
Here.
Supervisor Maggard.
Here.
Supervisor Couch.
Here.
Supervisor Perez.
Here. Thank you, Madam Clerk, and good morning, Kern County. Welcome to the Tuesday, July 28, 2020 meeting of the Board of Supervisors. We will begin today's meeting with the flag salute, led by our very own Supervisor Zach Scribner. Following the flag salute, please remain standing for a moment of prayer, silence, or meditation, whichever you prefer.
Salute. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. At this time, I would ask Mr. Nick Cullen, the Director of Animal Services, to come out with our pet of the week. Here we go. Hello, Nick, and good morning to you. Who do you have here?
This morning I brought with me, her name is Candy.
Oh.
She's about an 8-month-old terrier mix. She's frightened this morning. But like I said, 8 months old, she's just a pup. She doesn't look like it, but she's got a lot of energy, and she's going to make somebody a really good family pet. She's available right now for adoption.
Oh, my goodness. Again, what are the total costs and what does it include, Nick?
The normal adoption fee for dogs is $85. So $85 includes the spay and neuter surgery and all the vaccinations and a license for a year as well.
It is such a steal. It really is. And thank you for making that practical, being creative about that process. Candy, you're going to find a forever home, and we will miss you, but we'll be happy for you. Thank you, Nick.
Thank you.
Appreciate all you do. Thank you, Mr. Nick Cullen. The County of Kern provided notice that as a result of the declared federal, state, and local emergencies due to the COVID-19 pandemic and in light of the governor's order, this Board of Supervisors meeting is not physically open to the public. Our deepest apologies for that reality. Testimony and general public comment can be given through email or telephone to the clerk of the board prior to today's meeting, and live comments through teleconference will be heard during the meeting. We will begin by considering the consent agenda. All items listed with a capital C, capital A above the item number are considered to be routine and non-controversial by county staff. Consent items will be considered first and may be approved by one motion. If a member of the audience wishes to comment or ask questions regarding an item or items on the consent agenda, they may do so prior to a vote being taken on the consent agenda. A member of the board may remove any item from the consent agenda, and it will be considered in its listed sequence, with an opportunity for any member of the public to address the board concerning the item before action is taken. A member of the public may also comment on any closed session item. Consent matters begin on page 2, and they include items 1 through 3 and 6 through 7. On page 3, items 8 through 14. On page 4, items 15 through 21. On page 5, items 24 and 26 through 28. On page 5, items 30 through 37. On page 7, items 38 through 45. On page 8, items 46 through 52. And finally, on page 9, items 53 and 54. Madam Clerk, do we have public comment regarding the consent matters?
We do not, Madam Chair.
Okay. Are there any board members who would like any items removed from consent for discussion? If not, I'll entertain a motion on consent.
Madam Chair.
Yes.
Thank you. I'm going to abstain from the following consent agenda items, item number 24 and item 32, because of my wife's employment with Adventist Health. And
Madam Clerk, please record my abstention on each of these items. Even though I will vote on the motion to approve the consent calendar, my vote will only be for those remaining items. I'm also going to recuse myself on item 23, which is not on consent, for the same reason.
Okay.
Thank
Thank
you.
you, Zach. Colleagues, anything else? I see Supervisor Gleason.
Madam Chair, thanks for the opportunity to speak. I also need to recuse myself or abstain from voting on item number 33 due to the fact that my wife works for Ridgecrest Regional Hospital that owns Liberty Ambulance, so I will not be able to vote. I can vote on the rest of the consent agenda, but not that item.
You married up, by the way, Mick.
I did.
Yeah.
I did. I know I did.
Lucky man. Okay, very good. So we have some items recorded for the record regarding the consent vote. So at this time, if there is no other recusals or comments or removal from consent, then I will entertain a motion on consent.
So moved.
Thank you, Supervisor Couch. We have a motion.
Yeah, I'm trying to turn my microphone on, sorry. Second.
We have a motion and a late second.
Yeah.
Thank you.
Sorry.
Better late than never. Please cast your votes.
Thank you. The motion is approved. All ayes.
Thank you. We are going to move right along to our public presentations, which is item number 4. This portion of the meeting is reserved for persons to address the board on matters not on this agenda, but under the jurisdiction of the Board of Supervisors. Kathy, we have been receiving public input via email, through voicemail, and I have to thank you for your really incredible efforts to make sure that every document we receive is thoroughly considered by this board and provided to the public. You've really gone overboard. I appreciate it very much. What do we have by way of public presentation?
Thank you, Madam Chair. We have received, and you have in your possession, and you've also received electronically, 55 emails and 1 online petition with 731 signatures, all in opposition to closure of the Shafter Library. We also have received 3 voice messages concerning libraries. We're going to play those 3 voice messages now.
Thank you very much.
Speaking to you in public comments, I thank you for reducing the library's proposed cut this coming budget year from 20% to 7.5%. However, this proposed cut will continue to erode what was once a model of county-delivered public library service to what today is the lowest funded county library in California and one of the few funded exclusively by general fund dollars. This, in Kern County, identified as one of the least literate areas in America, a status determined in part by the absence of adequately funded libraries measured by budget, hours open, and close neighborhood proximity. Responding to 1978's Prop 13, that board chose to make the most drastic cuts to the library department. The 1990 budget cuts caused the library's highly regarded adult and family literacy programs to be eliminated. At the beginning of the 2007 economic downturn, that board sought to seemingly balance the entire budget on the backs of the Library and Parks Department with proposed cuts of $1 million each. This is not your parents' county library, well-funded and admired statewide. Yet, this library system has been able, up to this point, to enrich communities, offering resources, knowledge, free services, and programs, regardless of income or social status. It offers job training tools and Wi-Fi access to the many of our citizens without that access. In this time of public outcry to reallocate funds to help end social, racial, and economic inequities, the resources of a fully funded public library is one powerful tool your board possesses to answer those voices. Please reimagine how our vital county funds are allocated. Make your library department.
Good morning. For the 28th, my name is Donna, D-O-N-N-A, Malani, M-A-L-A-H-N-I, Jackson, J-A-C-K-S-O-N. I'm in District 1. My concern is something that the board hardly ever does anything towards because of the budget, the library. I have written in the last year and a half, or 2 years, between my supervisor, county council and the library about having automatic door button openers. And in this time with the COVID-19, nobody wants to touch doors. I even wrote a letter to the Bakersfield Californian. It took them a while because I had called every branch, even the ones I've been to, that have sensors, which is half of them. All they had to do was change the word to many. In fact, one has fundraising to get themselves a sensor. County council didn't know why half does, half doesn't. I can figure that out. The good years when we had budget money like in the 80s and a few other times. It is really unfair, unjust, and unequal not to have these sensors. And if every business also did it, the price would come down and it'd create jobs. Right now, I broke my femur and I have to use a walker. And of course, you can't go into the library, but post offices are the same thing. Doors can't be.
Hi, my name is Alicia Martinez, calling on behalf of the Shafter Library. I would like to save the library because not only does this help the future of the children, but it wouldn't be fair to us. This is the only good thing we have in Shafter. And if you're going to close our library, might as well close every library we have in Kern County, right? Like, it's not fair. So please keep this for us because not everybody has access to computers. And after COVID, I know many kids are going to need the computers and the books, especially the books. So, yeah, please be considerate. Thank you.
Thank you, Madam Clerk. That concludes public comment concerning libraries. We also received, and your board received, 7 emails earlier considering the City of Bakersfield's posting of deeds. This is an item that has been reoccurring. I do have one email with a request to read this passage at the board meeting, so I'm going to do that. You have a copy. This is from Marie Smith, entitled, "Thank you, Kern County Staff and Supervisors. This is a general public comment for Tuesday's board meeting. I would appreciate it if my comment is read into the record. Chairman Perez and members of the board, I would like to thank you and staff for taking the step to revoke Bakersfield's access to the county's intranet. Our family is deeply concerned about Bakersfield's lack of concern for victims of domestic violence and how their behavior can impact survivors. It is simply inexcusable. I watched Ms. Raison's presentation at the last board meeting. Thank you for clarifying the history and issues that led to Kern County's action. Our family has been reaching out to the City of Bakersfield for months and received no response. Our family is very upset by Ms. Gennaro's statement that these are public records. I've included a copy of the recent Bakersfield Californian article at the end of this comment. At best, it appears she has not read the numerous explicit laws on the issue, or worse, is just ignoring the law. We are offended that she is saying victims are trying to, quote unquote, stir pot for protecting their safety. It's offensive. We are also concerned that she is telling people with concerns on the issue to go direct to litigation. This is a waste of time and taxpayer dollars and victimizes survivors of domestic abuse again. For these reasons, our family would like to urge the county to keep the suspension of the city's access to these records in place. It is clear from Ms. Gennaro's statement that she simply doesn't care about past, current, or future compliance with the law. If the city couldn't follow the law and their agreement with the county previously, why would the city do it now? Madam Chair, members of the board, that concludes public comment, except that we do have speakers on the line. So we're now going to go to our speakers. And let me confirm that our first speaker is available. I'm not seeing our first speaker, so let's go to our second speaker. Adam Cohen. Mr. Cohen, if you would unmute your phone by pressing *6, you have 2 minutes to address the board.
Can you hear me?
Yes, we can.
Yes, we can. Good morning.
Good morning. Thank you, Chairwoman Perez and members of the board. I just want to reiterate something that looks like it was already, done, but Want to thank you guys for taking action and understanding the seriousness of this issue. I won't kind of repeat what has previously been said, but the statement that was quoted in the Bakersfield Californian is quite concerning. So I would like to remind the Board of Supervisors of California Government Code 6208.1 and 6254.21. In spite of the city's statements, having this information out there is illegal. I also want to make you guys aware of that, there's a large volume of records that are out there, and it's still an evolving situation, but we have confirmed that at least one member of the Kern County court bench had their address exposed in this. And given kind of the tragedy that occurred in New Jersey recently, it's absolutely critical that the city take this seriously. And so I would just urge that the county and that Mr. Lipquist, as a condition for regaining access, that not only is there a verification process in place to ensure continuing compliance with the county's data security agreement, but also that they have to notify anybody who's been impacted previously, because I don't think anybody has a complete list of who has served previously as a DA, who is currently or previously has been on the judicial bench, or any victim of violent crime that could be impacted. And so it's really important that this be dealt with accordingly and that people are notified if they've been impacted as a condition of regaining access. So again, thank you to the board for your understanding of the seriousness of this issue.
Thank you very much, Mr. Cohen.
Our next speaker is Merritt Holloway. Mr. Holloway, if you would unmute your phone by pressing *6, you have 2 minutes to address the board.
Can you hear me?
Yes, we can. Welcome. Good morning.
All right, thank you very much. Just really quickly, before I start, to Supervisor Mike Maggott, I will be making an appointment to speak with you about these critical issues. Okay, and then I'm also announcing my intent to sue the government and health officials for putting its citizens' lives in danger by forcing compulsory mask mandates that ignore scientific data on face mask risks. And then now, reparations for American descendants of slaves. Black American slaves built this country and created untold wealth for America. Slavery, Jim Crow, prison complex, and outright theft and slaughter was how America repaid ADOS for centuries of free labor, rape, murder, and theft. It was the slaves sold on the White House porch that made the market that built this country. We're not looking for symbolism. We're looking for economic justice and the return of the things stolen from us, especially our minds. Cut the check. Okay, masks and the shutdown. Where is the emergency? Okay, our government, the CDC, WHO, Bill Gates, Fauci, and other government officials have been inflating death and case numbers and lying about if CV-19 exists. Dr. Andrew Kaufman out of New York has researched CV-19 and concluded that the health scientists have never even isolated the virus. Dr. Kelly also said that coronavirus, and I sent you this information before. Dr. Kelly also said that the coronaviruses are cyclical and they come in the winter and they cannot live in over 80 degrees. It's been over 100 for over a month. So we need to hear from Dr. Kaufman and other experts in the medical field separate from Fauci and Gates who follow the money, okay? So there have been numerous scientific studies on the efficacy of masks stopping the virus transmission all the way from 1981 to 2020, okay, that are saying what you're doing now is not the real science, okay? You're giving the pseudoscience. Even on the mask box, it says that products cannot be protected from CV-19 and virus particles a magnitude smaller. Extremely important. The CDC and other government agencies are changing their peer-reviewed scientific data to confit narratives. In other words, they're changing the data, okay, in the computer. Like say they had something posted last month and then now today they changed it and it's totally opposite, okay, and they're not using scientific data. So we look to the government for answers, but the government continually lies, like the controlled demolition of the 3 World Trade Center buildings on 9/11, the weapons of mass destruction in Iraq, the moon landing,
Mr. Holloway?
Libya, Saudi.
Mr. Holloway,
Is that it?
I appreciate your
Yes.
passion, really I do. You're going into a whole host of subjects that are not in the jurisdiction of the Board of Supervisors, but I do appreciate your passion. and we take all of public comment into consideration. So thank you for your time,
Okay.
Mr. Holloway.
Okay. Just really quickly, reparations, cut the check, reparations for ADOF.
Thank you, sir.
Okay, thank you.
Thank you so much.
See you in a couple of weeks.
Okay, thank you.
Madam Chair, we have one more speaker, Jasmine De La Aguila from Leadership Council for Justice and Accountability. Ms. De La Aguila, if you would unmute your phone by pressing *6, you have 2 minutes to address the board.
Good morning, Jasmine. Are you there? Can you hear us?
Good morning. Can you hear me?
Yes, I can. Now I can. You're a little light.
Okay. Can you hear me better now?
I can. Thank you.
Okay, thank you. Good morning, Board and Supervisors through the Chair. As you know, my name is Jasmine De La Aguila with Leadership Council for Justice and Accountability. The COVID-19 pandemic has created a really new reality that all of us have had to adjust in order to protect ourselves and our loved ones. However, it's been particularly difficult for some residents who live in compacted housing situations, and more than one resident has shared with us that they know of someone who has tested positive for COVID-19, but has had to quarantine in a hotel because they could not safely quarantine in their home away from their loved ones. And this causes immediate economic burden. And we suspect that this is not a unique situation or experience that we are hearing now. With millions of dollars coming from CARES and other economic relief coming soon to the counties, we feel like you must also respond to the urgent needs of community residents in order for them to properly quarantine. We have submitted a letter where we share our recommendations and hope that you and your staff can review them and take them in consideration when allocating care funds. Some of them talk about addressing the backlog of COVID-19 test results. We've heard residents say they've taken over a week, and we know that's becoming more and more common. Others talk about ensuring COVID-19 related materials and services or other information are accessible in many languages for the public to review. And we can go on with other asks as well. So we just ask that the board review such recommendations and please address them and help urgent needs to get addressed for residents who cannot quarantine in their home properly and safely. Thank you.
Thank you, Jasmine. I appreciate your input, and I believe sincerely our staff will read it and consider it. And to the extent that is reasonable, be fair in this community. I trust that process. So thank you, Jasmine.
Thank you.
Madam Chair, that concludes public comment.
Very good. Thank you so much. We received it through email, voicemail, and of course live, and we've accommodated everyone graciously, and I really, really appreciate that, Madam Clerk. So we are going to move along in the agenda. Our next item is board member announcements or reports. This is the time where we traditionally bring up our public health hero, Matt Constantine. I will tell the public that I know at least 11 health officials in our 58 counties in California have walked off the job during Corona. Matt has not done that to us. I'm pressuring you now not to do that to us, Matt, because we need you and we appreciate you, and I know it's tense, and I just want to say thank you for all that you're doing, and don't leave us. Thank you.
Madam Chair, thank you. This is why we're here. This is what we do, and this is what we went to school for, and why we're here, to help out. If you don't mind, I'll just give you a brief update on some of the efforts that public health is engaging in. We've spoke about this a little bit, but the governor issued a revised order to address some increasing cases statewide. On the 13th, the governor announced that bars and restaurants needed to shut down or limit services statewide and not just in those counties that were not meeting the metrics. And he also removed the ability for us to reopen once our metrics have improved. Those were important distinctions. He also ordered the indoor closure for a number of businesses in counties that have failed the state's monitoring program for 3 consecutive days. And this was indoor fitness centers, indoor places of worship, indoor offices for non-critical infrastructure, indoor services for personal care, indoor hair salons and barbershops, and indoor malls. Now, initially, Kern was not required to comply. There was some confusion initially. However, since that time, Kern was flagged by the state for not meeting the state's metrics for 3 consecutive days. And on Friday, July 24th, the governor's order applied in Kern County. So those facilities that I just listed off were no longer allowed to provide indoor services. We have also been continuously working with our ambulance providers in the county, like our healthcare professionals. They are also feeling the burden of dealing with increased call volume and increased stresses on their system. Over the last 2 weeks, we've been working specifically with Hall Ambulance. They have notified us that they are experiencing a significant call volume, that they have had to transport more than 1,000 COVID positive or suspect COVID patients, and after every transport they have to clean every ambulance, and it takes 5 hours to clean. And they're also experiencing extended offload times, more than normal, because in the world of COVID, there's interest in trying to isolate those that are being offloaded. So at times they're asked to remain in the ambulance while they're actually at the hospital. Those factors have resulted in some significant reductions in staffing and availability for ambulances to provide services and to meet their regulatory and contractual obligations in Kern County. To ensure their coverage, they have contracted with Liberty Ambulance out of Ridgecrest to assist and to ensure adequate coverage on the eastern portion of Kern County. Liberty Ambulance has also helped to provide coverage during weekends because they were also very busy the last few weekends. And last weekend, the state deployed an ambulance strike team down to Kern County to assist Hall in response. That strike team was comprised of 5 ambulances and 11 staff that came down and were able to respond to calls. I want to acknowledge again Liberty Ambulances and Ridgecrest Hospital's continued support of services in Kern County. They have been fantastic in filling in the gaps when needed, not only with coverage for ambulance services, but also coverage in skilled nursing facilities. Also recently announced was Kevin McCarthy's ability to secure what they're calling a surge testing site in Kern County. This has only been deployed in a few other states. This is a federal commitment coming from the U.S. Department of Health and Human Services, and it has been allocated to Kern County. They have contracted with a company called True North. They are here today. They expect to have a surge testing site established at the fairgrounds and operational by tomorrow morning. The proposal was up to 3 sites. We're starting with 1, and we're exploring if there's needs for more. Their objective is to test 60,000 people within the next 12 consecutive days. They have a 3 to 5 day turnaround time for their lab results, which is a better turnaround time than we're experiencing elsewhere. And that information will be coming out more today and tomorrow. I think there's a press event tomorrow to formally announce it. But the state is here ensuring that that surge testing capability is active and ready to go by tomorrow morning. Supervisor Couch has also been instrumental and Sal Moretti about establishing a mobile testing facility, which we haven't had yet. The target, of course, is to help serve the underserved farm workers in their places of employment. We take the services to them. That is a partnership with the California Farm Workers Foundation and Good Samaritan Hospital. It kicks off today, starts in Delano, Lamont on Wednesday, McFarland on Thursday. It's a countywide effort, but is a fantastic addition to the different types of testing that we have occurring in Kern County. Also of note is the hospital staffing. This is an item that is on the consent agenda, but it's important to note that Supervisor Maggard and Scrivener have helped tremendously in allocating some CARES dollars to help hospitals staff their ICU beds. As we've spoken about many times, And as we've learned, it's not the number of available beds that we're concerned about, it's those that are staffable, meaning having enough ICU nurses to ensure that they can take care of everybody that needs it. And they are in short supply. So this item is unique. It requires that each hospital staff up to their licensed beds. These additional nurses that we will provide provides additional beds, additional capacity within Kern County. And that is unique. We've gained a lot of attention statewide about how we're doing this. It provides up to 84 ICU nurses in the county. So that's terrific. Yesterday, the governor did announce the allocation of $7.1 million to Kern County in 4 strategic areas. He specifically identified the Central Valley as needing some additional resources. They have these 4 areas that are applicable to Kern. Enhanced surveillance and workforce capacity is one. Improved public health surveillance and reporting of data is another. Use of laboratory data to enhance investigation, response, and prevention, meaning contact tracing, is another. And finally, coordinating and engaging with other countywide and statewide partners. So that we're still digesting this 17-page document that accompanied the money, but that $7.1 million has now been allocated to Kern County to aid in our response. As has been reported previously, our hospitals are struggling with staffing issues. There is a mutual aid process that's in place to allow hospitals to request additional staffing if it's needed. Mercy Hospital started this request and the other hospitals have followed. They have submitted formal requests for additional staffing from the state. Delano Hospital was the first to proceed through the state's process. They have to take some pretty significant actions to limit services that the hospitals are providing, elective surgery, outpatient surgery, so that we focus on the areas that are most in need. So the state has allocated some staffing that will arrive tomorrow to Delano Hospital. It's a 72-hour deployment. It is comprised of 2 RNs, 6 what they call military paramedics, and it looks like a doctor that's also allocated. So it's for 72 hours, arrive tomorrow. It can be extended another 72 hours if needed, but that is additional resources that is being allocated from the state down to Kern County. We expect, as the other hospitals review some of the paperwork and requirements, that there will be additional resources coming, but Delano is leading that charge. And then finally, of note, the Fresno County Alternative Care Site, or ACS site, is becoming operational. They have chosen to start taking patients at the Fresno Convention Center in their ACS. It's about $1 million a month they're going to expend. It'll be able to take up to 25 patients at a time. It can be expanded, I believe, up to 50. They are taking non-COVID patients. Their approach is to try to relieve the burden on hospitals and to take low acuity hospitalized patients so that the hospitals then are in a position to actually increase capacity for COVID positive patients. Madam Chair, that's a brief summary of some of the activities that are occurring, and of course I'm here to answer any questions.
Absolutely outstanding. Matt, thank you for, and really big hats off to Supervisor Couch for the first mobile and for farm workers. We know how insidious this is for Latinos, not just here, but around the state. Many are the frontline service workers in this community, not just in ag, but in every conceivable sector. We know Latino members of this community are suffering at higher rates and have less resources. It's just the reality. And so really, I want to thank Supervisor Couch for that thoughtfulness and the precision and creativity to be mobile with a group that we are relying on so heavily for our food chain, our food supply chain. It is a big deal. And thank you, Supervisor Couch, really
thank you.
remarkable leadership there. I do want to tell the public that the fairground site was previously my site, and it is no longer my site, obviously. The president trumps me, apparently, as it should be. We are not in charge of that site. We are not responsible for what's happening there in my office. I understand a host of people today had appointments. They were not informed that they were canceled. This all, of course, happened very abruptly yesterday. And so I want to apologize to members of the public who were set to be there today and receive a test and could not do so. I feel responsible for that, Matt, but that's life and that happens. But I do want the public to know in no way, shape, or form is that site under my control or influence in any way, as all of our people were let go of yesterday. So I just want to be clear about that to the public, and this is an exciting opportunity to do surge testing. I hope it works, Matt. Whatever we can do to drive traffic and be a great partner in that, I think is a really smart thing to do. And as we continue to be creative and this thing rolls out, and we sort of go week by week and sometimes day by day, hour by hour in your world, I know. So thank you for your work. Supervisor Gleason, are you
Well, I have a
punched
quick
in now?
question. I was
Please.
plugged in from before, but I do have a quick question.
Thank you.
For you. I remember earlier you commenting that your modeling was projecting a peak July 28th.
Yes,
Today's
sir.
July 28th.
Yes,
How's
sir.
that? So my question is, how's the modeling? How do you look back and see it? Is it accurate? Can we take lessons learned and apply them to the future? Talk to me about modeling just a quick minute. Thanks.
Yes, sir. So the state provided some modeling tools for us that we've been using from day one, and it has showed a slow increase over time in the number of cases. More importantly, in Kern, we track ICU cases and hospitalized cases. We've identified early on that it's the ICU cases that are the limiting factor. And Supervisor Gleason, it has tracked pretty closely. So today was the day that the one day, months ago, that the model indicated there would be a concern. We are pretty close. As the hospital CEOs will tell you, as they're asking for help should tell you, we are getting near our capacity. We have available ICU beds. We don't have available nurses. So we're hopeful that the actions that you're taking today, allocating that money, will help. But the model is tracking fairly closely. We do run it every month just to kind of see how it's progressing, and we unfortunately are on target. And again, it's just a model, but it shows a continued increase until probably early February where it peaks, and then it comes back down into late summer of 2021. But again, as you get that far out, the reliability of the model isn't perfect. But so far, it's done fairly well.
Thank you, Madam Chair. Thanks, Matt.
Thank you, Supervisor Gleason. Supervisor Couch.
Thank you. I was going to really, I appreciate the thanks, but I want to thank a few people. And first of all, I want to thank you, Matt, and your department. I want to thank my staff, specifically Sal, who's worked on this a lot for us. But I also want to thank Good Samaritan Hospital, particularly Amandeep Asra. Kelly Gladden was helpful, and also the California Farm Workers Foundation and Hernan Hernandez and his staff. Without them, none of this would be happening. So I'm really thankful for their help and appreciative of your help as well. So pass that on to your staff if you would.
Yes, sir. Supervisor Couch, not a lot of people know that our offices have been working together as well. Christian Roma out of my office, who's the testing guru of Kern County now, by virtue of necessity and how life happens. And I know that he has been interested in and working hard with your staff, and your staff's been marvelous. So I think we got to do more of that, David. Okay, very good. Supervisor Couch, you're done. Any other comments from colleagues before we move to our ad hoc committee? Okay, Matt will probably have more questions of you. And I'm going to move this time now to Supervisors Maggard and Scrivener. They are the members of our ad hoc committee, and they're going to provide us an update. Supervisor Maggard, the floor is yours.
Thank you. A lot has been going on, and I appreciate very much the support of staff, and Supervisor Scrivener is so reliable and on top of things. He's just great to work with. I want to thank all my colleagues for their support for this effort, because this wouldn't be happening without all the members' support and effort. So thank you for that. Matt, could you give us several of the issues that we typically talk about are going to come up during agenda items this morning, with the loan program and with the staffing for ICU beds and whatnot. Matt, could you give us any kind of a update on how we're doing with our skilled nursing facilities? There is concern in our community about the loved ones that are in there, in those facilities.
Yes, sir. So unfortunately, Supervisor Maggard, through the chair, we continue to struggle with the control of the virus in our skilled nursing facilities. We have a number of attacks that we're approaching this on. One is Georgiana Armstrong and her efforts. She has integrated herself with the state. She has established a hotline that people are calling in today. We have daily meetings with her. She is changing the policies on allowing visitors, on allowing ombudsmen to enter. She is the passionate advocate, and we're going to see some changes hopefully soon based on her efforts. The contract that we had, the board approved last time with Jared Levitt is functional. He has actually done a lot of research. He is boots on the ground. He is evaluating infection control procedures. He's actually going along with the state during inspections. So he was at 2 facilities yesterday. He's at another 2 today. And unfortunately, he is finding significant infection control breakdowns in the system that helps explain to us why this hasn't been controlled. So we need another week or 2, but I think we'll be able to report back on our efforts and what is the outcome of those efforts. What is the quantifiable changes that we're bringing about? But unfortunately, there are still significant issues, even so many months into this.
One of my concerns about the skilled nursing facilities is the consequence to the patients that are in there and their families. I was in contact just a few days ago with a woman whose mother died in one of the facilities. She died inside the facility. Her death was not COVID related, but when she went into the facility to gather her mother's belongings and to view her body, she was surprised, shocked at what she saw in the room. The public being kept out of the facility is causing an environment in which I'm afraid they're just not following protocols. And I'm grateful that we now have someone who is looking inside. I don't know what to do about this issue, though, because it is not our response. We are glad to step in and try to do something, but we do not have the authority to close them down. If they are closed down, where do we put them? There is not enough money in the coffers of all the county to pay for the transfer and care of all those patients. But we have this consistent problem that the state-regulated facilities are rampantly not taking care of people. So I don't know how we deliver that message more effectively to the state, but we must continue to ring that bell because lives are at stake, and it is not, it just astounds me that it's not better than it is, and that we can't provide an alternative for them. So thank you for that.
I will tell you, Supervisor Maggard, the first place that Jared Levitt went into yesterday resulted in the state placing that facility in what's called immediate jeopardy. It's a title that they label a facility that is truly in immediate need of changes. And that's the second time we've ever heard that being applied. But as you just stated, there's a lot of work ahead of us.
Yeah, sometimes the immediate jeopardy can be, there's an array of issues that can cause them to be in that jeopardy, right? I remember one facility that was the case because they had no on-site manager. Yes. There were people working in there and not one manager was in the facility. So even though the state puts them on immediate jeopardy, what concerns me is very often soon thereafter they take them off that list and there's no other consequence. I don't know how the state can sleep at night knowing that that's the case. So I know that it causes us that level of concern. I hope that they can do more about that. Could you please give us a little bit more background about, in spite of all the efforts we we put together to try to open up as many businesses as possible and therefore preserve the jobs of thousands of people in Kern County, we are now in a position where that's swinging back the other way. And it is a different circumstance than it was. Regional variance does not appear to be possible for us now. So could you give us some sense so the public understands how we go back to the point of being able to open up businesses and therefore those jobs that go along with them? And frankly, how we're going to have to wait for the governor.
Yes, sir. So unlike previously, the governor has removed the ability of a county to resume normal operations once we are able to achieve some sustainable progress. He has removed that ability from us, and now for bars and restaurants and the whole host of other places, churches and personal care facilities that I've mentioned, we are not able to reopen those locally. It has to be done by the state. So regardless of our individual metrics, the state will decide as a whole when the state can then allow these facilities to resume operations statewide. That's the last information that we've heard from the governor.
I just want to make sure that's clear to the public.
Yes,
The governor, is it not the governor's intent to not allow anyone to reopen until everyone is, until he decides that it's suitable for everyone throughout the state, which means we are now held hostage by the responsiveness and the ability of the poor, the worst performing county in California that may now prohibit everybody else from opening back up.
That's my understanding, sir. It does seem to change often, but that is our current understanding.
Well, I hope when the time comes, he listens to us about that. There are other issues that will come up, particularly about the staffing issue that will come up when we do that, and the loan issue, as I mentioned. So I think with that, I'll defer to my colleague, Supervisor Scrivener.
Thank you, Supervisor Maggard. And there's been obviously a couple of issues that we've identified, I think, locally. One is obviously the hospital staffing issue. I haven't participated in those discussions under advice of counsel in regard to my wife's employment, so I've left that up to my able colleague, Supervisor Maggard, to take that on for the last 3 weeks. But something that has been on my mind quite a bit that we have been talking about is the turnaround time for the tests that are being administered. So we're doing thousands of tests. And because of the constraints on the labs, their ability to turn around, we've seen longer and longer lag time, which I think makes it difficult for us to effectively contact trace when you don't get those results. And that's a big deal, finding out where people may have contracted it, who they may have been in contact with, and also with what we understand as far as the time that, the disease from when you contract it, when you might become symptomatic, could be up to 14 days. So if you don't get a lab test, if you don't get a test done in 14 days or processed in 14 days, then, that data also could be lost. And so I think that that's what's important about Congressman McCarthy's site is that it has the lab in place. So they're going to be able to turn around the tests that they're doing at their site. But I think we still continue to have challenges. So specifically, back to the subject of the state's funding, we've been notified $52 million, I believe, for the Central Valley, approximately $7 million coming to Kern. And so what are the priorities that we see, and what have we learned as far as what we can use that funding for contact tracing and also enhancing our ability to process these tests and try and reduce that lag time so we get timely data that we can actually use effectively?
Yes, sir. And just to clarify, the surge testing site, although originally they had identified they had a mobile lab with them, that has changed. So the information I provided to you earlier, Supervisor Scrivener, has changed. They contract with a different lab. We've asked them to make sure, can they still achieve those turnaround times, and they indicated they could, but that information changed for me, and I failed to update you. So the funding allocation just came out. It looks like there is a lot of opportunity for us to apply that in areas where we need it. Contact tracing is a big one for us. At 10 today, we're going to report 1,893 new cases and 12 deaths. those are high numbers. And the problem with that is there's 1,893, but many of those are from labs that have been delayed. Some of the hospitals are telling us it's up to 19 days now to get results. We have actually been told that some labs are holding asymptomatic, non-essential worker samples until the turnaround time improves for healthcare workers and first responders with an indefinite amount of time. So you can imagine contact tracing on something that's 19 days old is really difficult. Not only that, we're now learning that many of those lab reports are incomplete. So you'll see on our website, we are not able to identify ethnicity much any longer. The unknown category is growing because we now have to call every single person and ask if they would declare the ethnicity because it's blank on the form. That's really time intensive. And we are finding more and more errors. They left off date of births. Without DOB, you can't link it to what's going on. So that takes tremendous amounts of time. For every one positive, there's 4 on average, 4 contacts. So if you take 1,893 today and times it by 4, that's how many that we're having to do today. And you can imagine the phone calls and back and forth. And we actually started tracking how many wrong numbers there were on those lab reports. That's a lot. So it's not only delays, it's information that's incomplete and in some cases inaccurate that's causing us problems. So our hope is we need to get creative on how we use that money. We got to find better ways to do this. I have labs that are reporting electronically and reporting by fax. They send in 2 samples for the same person. It takes us a long time to try to link those and say, wait, that's the same one. We got to do better than that. That's going to help us tremendously. So there's a lot of struggles. I don't have yet answers for your specific question. We have our group that's working on it today to try to not only understand it, but figure out how can it be used. Beyond the 17 pages of guidance, we need more clarification. When does the money come in? How do I get it? Is this approved? Is that approved? We're actually talking about meeting with all the Central Valley counties that were identified by the governor and asking them, what are we doing as a group? Because we all link together. So a lot more work to come, but I'm hoping that that's going to help.
Okay. Last question. Supervisor Maggard mentioned the skilled nursing facilities, and I know that he's really been on top of that issue, and we appreciate his efforts. With this state funding, has there been any discussion, since these skilled nursing facilities are state facilities, they are permitted by the state, they're managed by the state, as far as compliance is concerned, they're managed by private companies, but as far as compliance, that's the state's responsibility. We're doing the best that we can to try and compel them to institute some better practices. But has the state talked about providing any funding to go after that specific issue of the SNFs? Because that isn't just an issue in our county. When I speak to other supervisors from around the state through our CSAC group, that is the significant issue for them as well. So what has the governor said about providing more resources to tackle that problem, which is a glaring one?
We have heard that the skilled nursing facilities have received money from the feds and the state directly. We were told that every skilled nursing facility received $50,000 from the federal government and $2,500 per bed. I don't know that the accuracy, that's what we've been told. That's a lot of money. The state has increased reimbursement that they can submit by 10% for the next 4 months to try to address some of the COVID-related expenses. They have been shipped PPE directly from FEMA so that they have an adequate supply. So there are resources coming in. Our concern is that yesterday we watched people go from an infected area to a clean area where residents are able to traffic between them without changing, we're moving the disease. And this is just something we can sit there and observe. That's not okay. We need to do better. And I think it's the infection control functions that need to improve, and the state needs to enforce the rules they have. So beyond those 2 sources of funding, Supervisor Scrivener, I don't know anything else the state's doing. Okay. We're the ones telling them, you need to enforce this. We're finding the violations and giving them to them and asking them to do something about it. But it's been a struggle.
Okay, thank you, Mr. Constantine. Supervisor Maggot, I'll turn it back to you if you had anything else. Thank you, Madam Chair.
Thank you. I see you punched in, Supervisor Maggard.
Yeah, Thank you, I appreciate that. With regard to the SNF issue, we tried once before to assess some penalties and fines on a facility that was operating in Kern County. It was a waste disposal recycling facility where a couple of young men died. We were sued. Those fines that we levied that we thought were reasonable were deemed to be unreasonable. I'm interested in exploring if there's any level of local fines or, I'm not looking to enrich our coffers at all, but what can we do to stimulate them to move forward? And Ms. Raison, I'd be interested in your perspective as we go forward about what we might be able to do about that. I have an idea about that I'd like to just run by you for you to think about. You're the expert, not me. But with regard to the test result turnaround, particularly for the San Joaquin Valley, where we now see this up and down the valley, right?
Yes, sir.
So this is kind of a parallel to the strategy that we came up with on how to staff ICU nurses, which is to pay a premium to a broker to be, and we're going to talk about this at more length, but pay a premium to a broker to make sure that the staff would be allocated to us. And that premium is large enough that it incentivizes those nurses from all over the country to come here instead of go somewhere else. That is self-serving. It is, but it is what I will gladly do every day to make sure that the people that we represent are safe. Can we do a similar thing with regard to this testing? Is there any way, I'd like us to explore if there's any way we could contract with labs to do work for Kern County, or if necessary, lab to coordinate with this consortium of the 10 Central Valley counties. Do we need to pay a premium? Is there something we can do to make sure that we are adequately able to manage, we're doing everything we can to manage the disease as it's evidenced in our own people? So I'd like us to explore that possibility to see if either that, or is there any way we can stand up our own lab dedicated to our own tests. So, I mean, it's what you're describing is, our hand, both our hands are tied behind our back as we're just watching the parade go by, the parade that is the spread of this disease when we can't manage it that way. So,
Yes,
do you have any thoughts about that? And is that something you're willing to work with us to see if we can do?
Absolutely. We'd be pleased to do so and look for all potential options. Yes, sir.
Okay. Happy to brainstorm with you about that after
Thank
the
you.
meeting's over. Thank you. Thank you, Madam Chair.
Thank you, Supervisor Maggard. Any other questions of Matt Constantine at this time? Seeing none from staff. Okay, I want to make two rather nice announcements this morning under this agenda item, and one of them involves my good friends over at Haddad Dodge. I learned last week that they are, of their own accord, engaged in a contest amongst their employees that if folks can wear their masks the entire time that they're at work, which we know is a bit of a pain, Kathy Krause, if we're being honest, they will be entered into a spin the wheel raffle with prizes up to $1,000 cash. And I just thought that was so clever, and apparently it's working very well, and they have found a way to incentivize the people that are helping them stay afloat by engaging in this really fun process of which it has boosted morale. And I thought that was worth noting, Ms. Krause. And then, of course, to our friends at Samco. If you haven't heard of Samco, they have been in Bakersfield since 1992. They have 6 Samco food stores, currently employ 128 people, and at full build-out this year, 250 Kern County families employed through Samco. They have been delivering water, PPE, and thousands of masks throughout the community, mostly at Kern Medical. We delivered some of this PPE, snacks, water, masks, hand sanitizer to Kern Medical, and really gave some TLC to the frontline staff there. And I want to extend my gratitude, my heartfelt gratitude and thanks to Samco for giving of their prosperity to this community and thinking of their neighbors as people that we should be looking out for and finding creative ways to contribute. and of course to the folks that had their creativity in the private sector to improve health outcomes and to do so in a creative and fun way. I think those are noteworthy, and I appreciate the opportunity to inform my colleagues about those positive aspects of otherwise a very difficult time for all of us. So thank you. We're going to move from board member announcements or reports, and we're going to move to the, under CAO's office, item number 22, which is an update on Kern County's Low Barrier Navigation Center located at 2900 M Street in Bakersfield, and a major hats off to the team that has continued to make progress on low barrier navigation despite the once-in-a-century pandemic that is consuming so much of life and energy and opportunity. You guys have found a way to continue progressing and be successful, and I really, really appreciate you. So thank you. Looking forward to the update to see how we're making progress within an existing problem that is going to be with us past Corona, as we know. So thank you. Amanda, the floor is yours.
All righty. Good morning, Madam Chair, members of the board. I'm Amanda Reese from the County Administrative Office. So the item before you is an update on the M Street Navigation Center, which is the county's low barrier navigation center. As you know, it's been open for a little over 2 months now. So in the middle of this, we know that we've been experiencing the COVID pandemic, and the shelter itself has experienced some impacts from that. When we began this project, we were anticipating having a capacity of 150. Some of those intake would be through referrals or through walk-ins. We would have a day use area where anybody could come off the street and have some reprieve from outside. Because of COVID, we are unable to do that. So currently we're a referral-only center. We've reduced capacity. So when we opened in May, we started with a capacity of 25 so that we could, one, get used to the operation of this facility, but also be able to monitor the health impacts that could arise. Now, since we, it's been 2 months, we've increased that to 50, so we have about 50 individuals staying overnight. It's primarily about 30 males and 20 females. In addition to that, we've implemented temperature screening upon entry, so we do have security doing that temperature screening. They are social distancing in the day use area, also in the bed area. So originally we had planned to have just a single layer beds, so the beds would be arranged with everyone next to each other. We've had to adjust that and construct them into bunk beds to allow that, that social distancing space between each bed. In addition, we've, as you can see in this picture, all residents and staff have PPE. We also have Kern Medical on site for just general medical screenings, but if there were any residents experiencing any symptoms, they could provide that assessment and then have that person tested, and then we would deal with that situation upon that arising. We haven't had that to this point, so we've been pretty fortunate. And so here's the resident breakdown by zip code. So I wanted to kind of get a picture of where these individuals are coming from and which part of town. You can, and just a note that this is all self-reported. So this is what we are asking, where their last known residence was or where they stayed the night before entering the navigation center. So this is based on what they have reported to CAPK staff. You can see that in the 93305, we've had 11 individuals. 93304, we have 7. 93301, we've had 8 individuals. You can see that there's 29 in the unknown, declined to state. Some of them simply either did not want to report that, or they really didn't know where they had stayed the night before. So we'll continue digging into that information, seeing if we can pull better data, but that is kind of where we're landing right now. And you can see we kind of have just some one-offs from Chicago or from Oregon. We have 1 from Lake Isabella, 2 from Delano. And so these are all referrals from flood ministry. So flood is going out, engaging with these individuals, assessing who is ready to be housed, and then they transport the residents into the navigation center and assist them with that intake with CAPK staff. So the services, like I said, flood is providing that referrals. We are referral only. In addition, Camp K is providing 3 meals daily. Any leftover meals are given to flood ministries, and when they go and do outreach, they provide those meals to create that relationship. So hopefully in the future, those that are resistant to help will eventually want to come and stay at the Navigation Center. Behavioral Health and Recovery Services is providing mental health care daily in addition to substance use care. They also assist in staff trainings and perform kind of like a town hall meetings where they'll, kind of discuss what they like, what they don't like at the Navigation Center with the residents, and then staff will adjust. Kern Medical is providing those medical appointments. If there is maybe like a minor issue that they can address immediately, they will address those immediate medical concerns. They've also started client activities like movie night, Bible study, arts and crafts, and they really gauge that off the residents. So if there is that need, they will create that activity for them so to entice them to stay during the day. So if you haven't been there in a while, there is a new mural on site, which is really colorful. It's really a great story. I want to thank Stewards Inc. And Councilman Andre Gonzalez, who commissioned this mural and allowed Creative Crossing to come on site to paint this on the wall at the Navigation Center. The Bakersfield, California did a great story on this. The 2 ladies that painted this were actually formerly homeless in their youth, and so we're really happy to give back and create a brighter space at the Navigation Center. So this is the M Street Cafe. Before, when we opened, this was just an empty storage area. CityServe took it upon themselves to just add furniture, paint it, put some quotes on the wall, and make it an inviting space. You have volunteers that come and run it. So what they do is they provide coffee to the residents so they're able to kind of hang out, get access to additional services. It's also a store of sorts, so they provide like socks, clothes, toothpaste. They also accept donations for those items, but it's just a way for them to connect. I think they're looking at starting fellowship in this area. Right now, I think they're open 1 day a week, but the residents have really responded to it, and it has really been transformed by CityServe. As they continue on, CityServe, I know, is beginning their job training program, which they do in collaboration with Bakersfield College. So they'll also start doing that on site. So case management. So, we really want to make sure we're being successful and we're transferring these individuals to permanent housing, as they stay at the Navigation Center. So they are engaging in case management. So far, we've had 3 that have been reunited with their family. 9 are ready to start that housing search. In many cases, that means that they have received their housing voucher, but they have not yet been matched to an available housing. So I wish they could be here to tell their story. They have to, I'll have to tell their story for them. So a few of them, Ruben was a resident at the Navigation Center, he was very resistant to help, didn't want to help out. As part of the Good Neighbor policy, Camp K began a sign-up sheet so that the residents could come and clean, if they wanted to, they could volunteer to clean their property. So Ruben has done that, signed up very quickly. He now cleans the day room every single day. He maintains the plants that are on site. And in that time, he's reconnected to his daughter and family. So Flood and Cap K staff are now helping him firm up those plans in Arizona so that he can be reunited with his family. They also have Carlos, who was a young man. He lost his job, wasn't able to pay his rent, and became homeless. He's been staying a few days at the shelter. In that time, he was able to get a job at Walmart. So he goes to work every day and works with his case manager, and now he's looking for affordable housing. And they have Kristen. Kristen had a traumatic brain injury at the age of 11. She has cognitive and physical impairments that make it difficult, has not had access to the appropriate medical services since staying at the Navigation Center. She has now been connected to an orthopedic medical provider. So now they have prescribed her orthopedic splints and an assistive mobility device. She's also received her voucher and is looking to start her housing search. So those are just a few stories. It's been 2 months, and we know that we'll have more as we continue on. So some of it is housing, but we do know that as we stabilize our our residents, that connection to family is a big help as well. And that concludes my report, and I'm available for any questions.
I love the pictures, by the way. They're super helpful. I love the plants. The last time I was there, the coffee room or the cafe was only in its beginning stages.
Mhm.
That looks really beautiful.
Yeah.
What a nice touch to this facility that we are using to really entice folks to help them get better. That's a complicated process, as you know. The stories are wonderful. They really help us give some context behind who are our homeless population and how many of them have such remarkable disadvantages like the brain injury that really requires us all to step up as a community and do our part. We're all better for it. It's a no-brainer. So thank you for the management of this process and these stories. They're hopeful. And they're humane, and I think it's something we can agree to work on together. So thank you, Amanda. Are there any questions from the board, my colleagues? Supervisor Couch.
I know we have a place for pets there. Are people taking advantage of that?
Unfortunately, due to COVID, our manufacturer is for those kennels has been delayed, so that
part's not available yet?
That part is not available yet.
Okay.
Great question.
And you mentioned plants, and it occurs to me, I don't know if there's even an appropriate place for this, or a good spot, but a community garden there that they could grow some of their own stuff, fruits or vegetables might be a good idea. I don't know. I'll just throw that to you and you.
I know that
Think about
CAPK has received a response from some local organizations that may be assisting with a garden or additional landscaping.
Thank you.
Those are great life skills as well. If folks can learn to plant and grow some of their own food, or that process is also therapeutic, as you know. So there's a lot there. I appreciate that highlighting of that, Supervisor Couch, because those have many components to it that are helpful in life. So thank you. I don't see any other folks plugged in. Thank you for the update. We look forward to the next update and more good news. Are you in a position where you are wanting to bring more people in? Should we be doing some outreach? There was a facility that prior to Corona, my staff and I were engaging a number of homeless people in and really wanted to take them to the center with some precaution and safety, of course. But where are you on demand and ability to take more folks in, and should we be doing some aggressive outreach?
I don't think we're there yet. I think that would depend on the Navigation Center's ability to social distance, especially in like those congregation areas, because they're predominantly in that area given, how hot it is outside.
Sure.
So that is something we would have to probably discuss with public health. And then we would also recommend that they go through flood. So when we do have those referrals, we do have flood go out there to even see if they're open to going to the Navigation Center, and they'll make that assessment and then transport them.
I see. Would you please email me the person at Flood, the direct person with their direct line? I want to talk with them about this homeless encampment that's heavy on my heart and that I'd like to see some resolution on. Sounds like you may be at capacity, but at least if we can get folks in the process so that they're aware of the opportunity, it certainly can give hope to people and give some direction, formal direction. So could you please email me, whoever it is at Flood, that I can talk to about this particular encampment in my district?
Of course.
Thank you so much. Again, thank you for your hard work, and we look forward to the next update. Thank you. Moving along, this item does not require a vote or any action, so we're going to move right along to item number 23.
And Madam Chair, I just did want to publicly say we do not have any public comment for this
You
item.
did tell me that, and I should have put that on the record. Thank you. Ryan Alsop, to your team on the low barrier shelter. Well done.
Thank you, Madam Chairwoman. Thank you to Amanda Ruiz for all of her leadership.
Yeah, it really is remarkable. So we are going to move to I'm sorry, Supervisor Gleason.
Yeah, I just wanted to jump on there just for a quick second.
Your mic's off.
Very impressive. My mic's on? Okay.
There you
That was a very impressive presentation. And I was thinking as she was going on, and it just dawned on me that risk is just enormous over there. During this COVID-19 situation, the risks we're taking are enormous. And I'm more interested personally in having Amanda being able to come back on a periodic basis and talk about success than I am in talking about stretching capabilities in a place. I don't think now is the time to be doing something we're not comfortable with, something that I just think that risks are enormous that we're taking over there. And I just didn't think of that until you were making the presentation. Are you aware, how are you approaching managing the risks associated with what we're doing? And do you understand those risks that I'm talking about?
So I think staff is aware, and we've been, in contact with Kern Medical and with Public Health. We know that the need is great, but we do have to make sure that we're providing the safety for the residents. So they are masked. We are doing temperature checks so it's not just on their first intake. We are doing those temperature checks every time, they come back in. If they, leave for an appointment or leave for work and they come back, they are being screened again, and so they are being monitored. If they have any symptoms that arise, Kern Medical is there and is a phone call away, or their medical assistant is on site to be able to respond appropriately. But they are.
Great, thanks a lot, appreciate it.
Thank you, Mick. We're going to move on to item number 23, which is a proposed revision to the Coronavirus Aid, Relief, and Economic Security Act, CARES Act, Relief Fund Utilization Plan to fund contingency labor in an amount not to exceed $12 million to increase capacity at local hospitals' intensive care units, increase the local small business forgivable loan allocation from $25 million to $30 million, excuse me, allocate $500,000 for a countywide campaign for COVID-19 related advertising, and provide support for the Kern County Museum Foundation in the amount of $300,000, and the California State Soccer Association South in the amount of $365,000, two operators of county-owned facilities affected by the impacts of COVID-19. This is item number 23. It is under CAO, and I'm not sure who will be providing the initial presentation, but the floor is yours, CAO.
I appreciate that, Madam Chairwoman, members of the board. I'm just going to kick it over to Mr. Zerfus from our office.
Mr. Zerfus, so good to see you, and thank you for your thorough, consummate professionalism. The floor is yours.
Thank you, Madam Chair and members of the Board of Supervisors. This is, well, as you're aware, the County of Kern received $157 million in coronavirus relief funds through the Federal CARES Act. And back on May 5th, your board approved an initial utilization plan for how that $157 million would be allocated. We knew at the time, making that recommendation to your board, that there would be updates to that effort. That initial allocation was based primarily upon the needs that we had seen and were able to assess at the time, and using the guidance provided by the U.S. Treasury Department. Over the past couple months, we have seen those needs further develop as coronavirus has continued to be an issue in our community. We've also seen revisions and enhancements in the guidance from the U.S. Treasury Department on how these funds can be spent. So today, we're before your board with the first update to this allocation plan. It likely won't be the last update to this plan. We'll be back before you as these things continue to evolve to further recommend modifications to this plan as we see fit. So there's really two main things we're recommending to your board today. One is the allocation adjustments, and I want to walk through those with your board right now. And then second will be some specific implementation aspects to this plan with a few different organizations. So let's speak briefly on the allocation. So there is an attachment to the board letter that shows the initial allocation by category for each category of the $157 million, what that initial allocation was, what we've actually spent or have encumbered in those areas, as well as what our recommendations are for adjustments. And I'm just going to walk through the adjustments briefly here and for a moment. So the first adjustment is a reduction of $13 million in the city reimbursement category. That is so that we can reallocate those funds primarily to support the ICU nursing program that Mr. Constantine had spoke to earlier, and that was authorized by your board on the consent agenda earlier. It will also go to fund some of these other efforts. The primary reason that funding has become available for reallocation is because through the state budget process, additional pots of this same funding have been passed down through the state budget to the city of Bakersfield and the other incorporated cities. Because the city of Bakersfield has a population of over $300,000, they're actually eligible for additional funding from the state from the same pool of funding. So they're receiving about $33 million directly from the state for these same efforts to cover their costs with regard to responding to COVID. So they've been gracious in working with us in the ability to reallocate this funding to address some of the needs that we see before us now. We will, of course, be continuing to work with the city on any uncovered costs that they may have related to COVID-19, but that is the reason for that reduction. The second adjustment is an increase of $12 million in a new category called ICU nursing staff support. That is the effort that Mr. Constantine had referenced earlier, making available 40 additional ICU beds across a few different providers in Kern County. This would provide the funding to hire 84 nurses through staffing companies to place at these hospital facilities so that they can then open up these additional ICU beds, and that is, again, above and beyond their licensed capacity. Represents about a 17% increase in total ICU bed capacity, just to kind of put it in perspective. So that's a $12 million increase in that new category. Third, we're going to shift or recommend shifting $5 million within the small business support category, shifting $5 million from the business reopening support program, which is primarily providing for the PPE support program right now, shifting that $5 million to the small business support program, which is the Kern Recovers Forgivable Loan Program. So we have $25 million currently allocated to the Forgivable Loan Program. We have hit $25 million. We hit that last week. And in that effort, that $25 million went to support 806 different businesses across 238 industries. So all of that information is reported on our website, but that program is currently maxed. Because we had the momentum of that program and applications continuing to come in, we have continued to receive and review applications up to this next $5 million mark. As of yesterday, we had about $4.2 million lined up, ready to fund if your board were to approve this item today. That additional $4.2 million represents another 127 businesses. And we have additional applications that are being reviewed currently that would make up the difference. So we will be ready to fund that additional $5 million tomorrow if this is approved today. The one other reasons for the adjustment is that although we're seeing a lot of demand in the PPE support program, we've currently funded about 617 businesses with PPE. So we've provided PPE directly to 617 businesses. And we've stood up a new reporting site on the county's website for this program under Kern Recovers that reports out how many masks, how many gloves, how many sanitizers and such is being distributed. As a point of, I guess, just to give you an idea of what we've been doing, that's boxes of 50-count boxes of masks. We've distributed, as of yesterday, 5,064 50-count boxes of masks. So we are currently providing masks, sanitizers, wipes, and gloves. 100-count boxes of gloves, we're just over 4,900 boxes of gloves. So providing these county-wide through that network of 16 different locations. The reason for that we are recommending the program remain at the $5 million funding level, which is what you had approved, and then move this $5 million to the Recovers program, is that $5 million we're finding goes a long way. In fact, $1 million of PPE goes a long way. When we're buying in bulk and we're leveraging competitive pricing, we feel like we're currently well stocked on PPE and able to meet all of the demands. Speaking with our staff that are administering that program, we think $5 million is an adequate level to be at currently. On the other hand, we're hearing from the business community that the demand for our forgivable loan program is very strong, and there's an opportunity to shift that and get that money into place as quickly as possible. That is the reason for that recommendation. And then finally, there is an adjustment of $1.48 million into the county cost category. That does two things. One, it recognizes about $480,000 of interest that the county earned on this money sitting in the county coffers since we received it, and we'll reallocate that for this purpose. And secondly, $1 million to just balance out the transfers so that all the additions and subtractions balance out. So those are the adjustments we're recommending in the categories of the utilization plan. Speaking specifically to the other items included in this, we are recommending that the board allow us to move forward with, on the implementation side, providing support to two organizations that currently operate publicly owned facilities for the benefit of the public. And this is the Kern County Museum Foundation and the California State Soccer Association. The Soccer Association cares for and oversees the county soccer fields out by Hart Park. And the Kern County Museum Foundation operates the Kern County Museum, obviously. Both of those organizations have ongoing costs and have not been able to host their traditional events and their lines of business. They are both nonprofits and again operate public facilities for the benefit of the public. And it is our opinion that ensuring that they can continue to do that to preserve those assets for the public in the future is an important factor to consider here. And then finally, an allocation of $500,000 towards a countywide communication program campaign, rather, to educate and promote measures to limit the spread of COVID-19. And that is being done in conjunction with the city of Bakersfield and the broader health community. So we're partnering with the Hospital Association as well as the city of Bakersfield in a comprehensive advertising campaign to promote efforts like masks and cleanliness and hygiene and things that can go to limit the spread of COVID-19. So again, what's recommended today is approving those adjustments to the initial utilization plan and then authorizing those three specific components of that plan to be implemented. So I'm available to answer any questions that you may have.
Mr. Zervis, thank you. I know Supervisor Maggard and Supervisors Gleason are teed up to ask you something, but I just want to emphasize that and clarify with you that the monies to the soccer park and the foundation are for maintenance of county-owned facilities, of which we would have to provide staff, we would have to provide management and oversight, of which appears to me to be quite difficult under the circumstances in our limitations across the board. And would you agree with that statement?
Yes, Madam Chair, I would. If either one of those organizations were to not be able to fulfill their roles under the current agreements that they have to maintain those facilities will revert back to the county, and the upkeep, the maintenance, the care of those facilities becomes the county's responsibility. So we either help them ensure that they can continue in that role, or the county will wind up in that role having to care for those assets.
Well, I appreciate the protection of the county's assets and the maintenance of them so we can resume normality as fast as humanly possible, as you know. I'm not sure that's a word, normalcy, Kathy? No, okay. Thank you. Thank you. Supervisor Maggard, I'm sure you won't misuse a word like that in your presentation. Floor is yours, Supervisor.
Thank you. I mumble more than any member of this board, so I'm certain that I will. Mr. Zervis, thank you for your stellar work. Mr. Alsop, thank you for your leadership in this area as well. I'm happy to and will be glad to motion to approve item number 23 on our agenda this morning. But Mr. Zervis, could you give us a little bit of background about the visit from the White House task force that came here last week and their recommendation to us, their idea of how to leverage and a match from the federal FEMA program and how that might help us use these dollars even more effectively and garner more dollars for the desperate needs that we have?
I'd be happy to. Thank you, Supervisor Maggard, through the chair. The county was visited by a White House task force and representatives from FEMA for a day. And one of the things that we talked about fairly extensively was the ability to use the coronavirus relief funds as the local match for FEMA reimbursement through the Stafford Act. So in the case of a federal emergency like we're in now with coronavirus, the federal government makes available reimbursement up to 75% of allowable costs. Some costs are not allowable, and many categories are. That it gets pretty technical, but in general, those allowable costs, they will reimburse rather the county for 75% of those costs. Traditionally, that requires a local match of 25%, and that local match cannot come from federal funds. So that's normally how it operates. In fact, this is the only circumstance that I'm aware of where that's not the case. And the coronavirus relief funds in particular have been allowed by the federal government to be used as that local match. So now we have to get into eligible costs. So the county, we are reviewing our costs and categories and ability to file claims with the federal government for reimbursement. They are looking for costs in response to the pandemic, to the emergency. Some emergencies, it's much clearer to be able to define what those costs are. If you have a fire, it's pretty clear what's impacted by a fire and not impacted by a fire. In a long-term pandemic, those impacts are widespread, and so there's still a lot of unclear cost categories as to how much we're going to be able to claim. But we're going to claim everything that we can. And there are areas that are more clear. So for example, the ICU staffing project we're talking about is clearly a direct response to COVID to increase those. It doesn't fall in some of the unallowed categories such as county staff time, regular time. We'll be filing claims certainly for that, or for the consultants' work at the SNF facilities, and other direct costs related to COVID. So what does that mean? Means that the $12 million you're allocating currently, or we're recommending you allocate for staffing at the ICU beds, that has the potential, likely potential, to only cost us 25% of that, or allowing us to continue to expand that program to provide for more beds or for a longer period of time. So we'll be. I guess the big news from FEMA and the White House Task Force is that the local match can be fulfilled with federal funds, and we're looking to leverage that to any extent possible to make this pool of funding go further. I will add that the legislation being considered at the federal level, even as of last night and today, potentially extends the deadline for the use of coronavirus relief funds. That's one of the constraints we have on us. This pool of funding, as of today, has to be spent by December 30th, or it gets returned to the federal government. So when we talk about the ICU bed project, that's why it only goes through December 30th. It's because we don't have this funding available beyond that point. There's discussion right now in Washington about extending that date to a date uncertain at this point. That would be of great help to us to be able to use that in conjunction with this ability to use the FEMA reimbursement for 75% of those costs and spread that money further and be able to provide these beds for a longer period of time. So we're looking for that flexibility, looking forward to that flexibility. Hopefully that's included in this next round of aid from the federal government. So I hope that answers your question, Supervisor Maggard.
It does. Thank you for that clarification. I'm going to push as hard as I can, like I'm trying to do and continue to do, on the SNF facility management when I think government is not doing what it should do. But I also want to give praise to government when it's doing what we think it should, and frankly, I think exceeding our expectations. And this White House task force, helping us with this testing facility at the fairgrounds, helping us with this source of federal matching dollars that's going on. The governor, frankly, Governor Newsom, thank you to him for his assistance with this $57 million coming in. We are watching an unprecedented example of government, desperately trying to help us deal with a desperate situation. So I am grateful to them for that. The movement of the extension of the deadline through December 31 to a later date will be vital to us. We heard earlier that the expectation is that the crest of the wave of new COVID patients hitting our hospitals will go beyond the end of the year. The expenditure that we have teed up today for those nurses only goes through December 31st. It is very, very likely that we will need more nurses beyond December 31st. So using the strategy of matching these dollars and leveraging those dollars to get more money to hire more nurses is going to be an integral part of it. So I hope we will do that. And this idea, it may end up being an infeasible idea, but unworkable idea, but the idea of using some of these dollars to buy the reagent supplies necessary to allow testing to occur on a more a quicker basis and therefore help us to manage this disease. I think this is another potential use of this money. So thank you very much, and I'm grateful for your help, and thank you for the federal and state government for their help as well.
Mr. Service, I had a couple of questions for you here real quick. First of all, I like the idea about the soccer park and the museum, and I'm going to second the motion. I think it's really good that we're taking particular care. We're identifying things that need our attention, and I'm glad you're doing that. Thank you very much. And I like the whole deal. I would like you to explain a little bit more the last thing you said about $500,000 that is going to educational programs. And I think you were focused on Bakersfield, but is that throughout the entire county? And could you talk a little bit about that?
Yes, it is a countywide effort, and it's being done in conjunction with the hospital association, and Charlotte Briggs and that association is critical in moving that forward, and it will be in conjunction with the city of Bakersfield. We're partnering on this, but it is not limited to the city of Bakersfield. This information advertising campaign will be countywide.
Thank you, and I second the motion.
Supervisor Gleason, thank you. We do have a motion and a second. Any other comment? Okay. Excuse me. Public comment. Kathy Kraus, do we have anyone waiting to provide input, or have we received input?
We have received one voice message, which we will play now. This is from Donna Gentoli.
Yes. This is Donna Gentoli, DonnaGiuntoli. I read the article in the Californian about the CARES Act that they're going to spend $500,000 on an ad campaign, and I don't feel like this is necessary to spend $500,000 to tell people to wash their hands and wear a mask. I think it could be spent other places more efficiently. Thank you.
Madam Chair, we also heard from Jasmine De La Aguila this morning under public presentations, but her letter that you have a copy of, all board members have a copy of, was specific to the use of CARES Act funding. So I don't think it's necessary to reiterate her comments, but I will receive and file her letter under this item.
That makes sense, and I appreciate that. Thank you. Ryan, would you mind commenting on sort of the nature of marketing, if you will, and our need to communicate messaging to the public? I appreciate the sensitivity about this, Ryan, and I have heard from other people on it, sort of frustrated because, it's a frustrating time. So this is a kind of issue that can garner emotion, as you know. And I think some clarification would be so helpful. And I know that you have it. So if you could help me, I'd appreciate it.
Sure. Thank you, Madam Chair, members of the board. Just to clarify, that this communications campaign will not cost $500,000. It will cost a lot more. That is the amount of money we're asking your board to authorize, which we would kick in to the campaign. We need to open Kern County. We need to get businesses back operating and open, and key to doing that is practicing taking this virus seriously, understanding that it's here and it is spreading and will continue to spread for months, that we need to manage this spread by adhering to public health best practices, wearing a mask when you cannot keep an appropriate distance, distancing itself, hand washing, sanitizing, all of the things that we have been talking about. Those are all keys, really the cornerstone to managing the spread, maintaining adequate hospital capacity. We've heard from Mr. Zervis today about our plans to hire 84 additional nurses at great expense. We need to do everything we can to continue to manage this and to maintain capacity. Key to doing that is maintaining all of these great public health practices. We do that, the sooner we do that as a society here, as a region, the quicker we get back open. It's as simple as that. I want to thank the hospitals, our 10 acute care hospitals, their CEOs, their chief medical officers for really doing the work to get this campaign going. This will be a medical community-led campaign. Utilizing the brands that we're familiar with all across this county, the faces, the doctors, the resources of our hospitals will be put into this campaign. They will do the work to put the message out and to remind people how important it is to do these things so that we can open. And we are joining with the City of Bakersfield to help fund this effort. It will be at least for the next 6 months. And this is what we're asking your board to authorize today. Thank you.
Ryan, thank you for that. We know that marketing impacts and influences human behavior. That's why people spend money on billboards. That's why corporations invest the kind of money they do into branding, because we know that it influences behavior. And this is an issue that has become unnecessarily political and partisan and can be ugly, and people are very stressed out about it. Very stressed out. Major fights occurring through my own personal family. I mean, it's become the worst thing that's happened to us in a long time. It is just remarkable what kind of emotions it brings up in people, and that really breaks my heart. But I believe that we can be creative and not shame one another, and not compete with one another, but really be positive, creative. I love what the HADADs are doing to provide incentive to their workforce to be healthy so they can continue to make money, continue to keep people employed, continue to pay their taxes, the things in which our entire society is structured around. And in order to maintain that, we have to come together and have unity here. Almost as a war effort, Ryan, to come together and join on the front lines, do your part, make some personal sacrifice so that we can get back to normal as soon as possible. It really is detrimental in so many ways. It's hard to even really characterize, and that is utterly heartbreaking. But Kern County is a generous community. It is a neighborly community. And I believe that with the right kind of marketing, Ryan, we can influence behavior for the best without tearing ourselves apart in the process, which is something we have to be intentional about. So I want to thank you. I do believe marketing impacts behavior. I think we can do it positively and influence each other to think of our neighbors in this otherwise war-like time. That's really what we're in. And when we think of each other as Americans, I think we get our American neighbors, we get a lot further in so doing. So really hats off, Matt. The campaign, the commercial that we did, I've just received the most remarkable feedback that it is not a shaming effort, that it is positive. Your staff wrote a perfect script that incorporates, our togetherness. So really, again, Matt, to you, thank you. That brings us to the end today, Kathy, or this morning.
Well, first, we're going to go ahead and vote on item 23, and then we have to go to item 25 and then 29.
Okay, apparently
We're not done.
Apparently, I'm completely way off, so my apologies. We have a motion and a second. Please cast your votes, colleagues. I got a little carried away there, Matt. You said emotional time.
Thank you. The vote is approved. 4 ayes, 1 abstention. Supervisor Scrivener.
Another plug-in. Matt, please don't leave us. Thank you. Thank you. We need you. We need each other, obviously. Okay, so moving on to item number 25, we have a report by the Nadelson Dale Group on revised cost recovery methodology for municipal fire service contracts and request for approval of phased implementation to generate an additional $10.3 million annually for the fire fund once said methodology is fully implemented. Fiscal impact $10.3 million for fiscal year 21-22, $1.4 million fire fund revenue. Mr. Alsup? This is under the CAO's guidance, so the floor is yours.
Yes, ma'am, it is. Thank you, Madam Chair, members of the board. Before I turn it over to Mr. Zervis, my office, to handle this presentation, we do not have the Nadelson Dale Group here with us today. As you recall, this item was before your board some weeks ago. It was continued, asked by your board to be continued while we met with and had discussions with city managers. We did have a lengthy call and review of this item with the city managers across the county. This item is being brought back for your board for consideration today. And with that, I'll hand it over to Mr. Zervis.
Thank you, Madam Chair and members of the board. As Mr. Alstop referenced, this item was before you on June 30th, and so we're back before you at your direction. For a little history, on January 9th of 2018, the Center for Public Safety Management had delivered to the board a comprehensive operational and administrative analysis of the fire department. And that report included a variety of recommendations to to address operational issues and fiscal issues that were occurring within the fire fund and the fire department. Over the past 2 years, a large number of those have been implemented. And some that actually would cost money to implement were intentionally not implemented to this point, but from a fiscal standpoint, there's a number of them that have been implemented. Well, one of the key findings in this report was that the county moved to a full cost recovery model for contract fire services. I believe in that report it had referenced a recovery rate at the time estimated at about 47%. The Nadelson Dale Group was hired by Kern County to prepare an analysis and a study of just that issue, cost recovery for contract fire services. And they prepared the report that was presented to you on June 30th. That report indicated that the cost recovery was actually more like 19% cost recovered versus the cost to provide those services. Again, that was included in the June 30th report. And in that meeting, your board directed us to go back and have some discussion with the contract cities to talk with them because there was some surprise on their end about the report and the intention of moving into this full cost recovery model. On July 16th, we had a lengthy conference call, including all city managers, except for Maricopa, who had indicated that they weren't going to be on the call and had provided a letter to that effect in their concerns. The call included all of the other city managers, their staff, as well as consultants that they had brought on board to review methodology and advise them. We met for over 2 hours. We walked through in great detail with the Nadelson Dale Group the existing contract methodology, the reason for the changes, what those changes were, and all the various aspects of that issue. We answered questions from those city managers, and that call, I think, went well. It provided the information that they were requesting and the answers to their questions. Subsequent to that meeting, we have actually set up individual meetings with each one of the contract cities to go out and meet with them to talk about their specific situations locally. talk about the cost of fire services, and start that negotiation process about how we get to full cost recovery. So those meetings will start after your board approves the methodology and authorizes us to move forward. Yesterday, well, and I should say, obviously the Nettleston Dale group's not here. I am prepared to answer and discuss any questions that you have about the current methodology or the proposed new methodology. I know we walked through that in great detail on June 30th, so I'm not going to do that, but I am prepared to do that. If you've got specific questions or would like me to dig into some of those differences and the reasons for them, I'm happy to do that. Yesterday, your board and I received a letter from the contract city managers. It's an unsigned letter, but it does list all of the contract cities, so I'm assuming that it's authorized to be sent on their behalf. It requests a 90-day delay in implementation and brings up 4 different items that they'd like to work on. We are happy to continue to work through those items and provide information so that they can make that analysis and make decisions that would be appropriate for their jurisdictions. But that can be done concurrently with your board approving the methodology and authorizing us to move forward. That step, this next phase of contract negotiations will likely last over the next year before we have new contract language and methodology finalized and ready for implementation. There's certainly a notice period under the existing contracts to provide for that time frame. So there's a lot of time between now and then to get through and discuss the various issues raised in their letter. So it is still our recommendation to move forward today, and with the understanding we'll continue to meet with all of those city managers and try to provide information and discuss those issues that they've raised. I would also point out that the approved methodology includes up to a 7-year phase-in period. So that in itself provides the flexibility to those cities to be able to plan fiscally and adjust their budgets accordingly, depending on final negotiations, but gives plenty of time to make those adjustments over that period of time. So it's not a $10 million adjustment today for all of those cities in total. It's 1/7 of that per year as the phase-in proceeds. So I would point out that and I appreciate that the letter from the city managers recognizes the severity of the fiscal concerns that we're dealing with here. And they actually agree that they want to move forward in a way that would address the structural deficit in the fire department, or in the fire fund rather. That no one knows that situation better than your board. You've been addressing it long before I've been standing up here, and long before it's been an issue with city managers. In fact, on June 30th, your board took a number of very difficult but necessary steps to reduce operational costs within the fire department and provide additional ongoing revenue streams to the department in order to address that structural fire deficit. This issue of moving towards full cost recovery over this next 7-year period is another one of those steps. And it is important. We're not recommending that it be delayed, but we're recommending that you authorize us, that you approve the methodology, and you authorize the CIO's department and the fire department to start negotiations and move into implementation to move towards move to full cost recovery for those services. So again, I'm happy to answer any questions. I know the fire department is here and would also like to speak, address your board on this matter. I will stand by and be able to answer any questions from your board as well. Thank you.
Hey, thank you. And welcome to you, sir. Glad to see that you're healthy and you look happy even. That's nice.
You betcha.
Nice to have you here. Please state your name and provide your input. Thank you.
Good morning, Madam Chairwoman, members of the board. I'm Dean Bowler, Chief Deputy of the Fire Department, here on behalf of Fire Chief David Witt. Since Chief Witt was appointed, we have examined all fire department operations in search of operational efficiencies and cost savings. The operational administrative analysis that Mr. Service spoke of that we received in January 2018. We've been working diligently on that to address each and every one of the 62 recommendations. One of those is addressing the methodology that we use for determining contract city cost allocation. We feel that the contract methodology presented on June 30th meeting of your board is the fairest and most accurate method of allocating cost to each contract city because it utilizes the actual percentage of incident responses within city limits and compared to the unincorporated area. So it's very accurate. We believe it's very fair. So the fire department fully supports and recommends your board approve the implementation of the recommended methodology for determining costs for service for our contract cities. That's it.
Wow. Thank you. That was concise and very clear. I really appreciate it. Colleagues, do you have any questions? Okay, thank you. Oh, I'm sorry, Supervisor Couch. Oh, okay, not specifically. Okay,
Thank you
sir,
so much.
thank you so much. Supervisor Couch, did you want to chime in right now? Okay, we'll give it a sec. Do we have public comment, Kathy?
We just received the letter. You have a copy of that letter. You also received it electronically that Mr. Zervis was referring to from the incorporated cities. That's the only public comment for this item.
Oh, okay, thank you very much. Well, then I'm going to return to you, Supervisor, since you had some input, since we closed the public hearing portion.
Okay. I don't get it. I'm very frustrated, and I'm just going to lay it out for you. I tried to be a little more genteel about it last time. It doesn't matter. This could be the greatest cost-sharing or cost recovery formula ever invented by man. It does not matter. I think we need to go have these individual meetings with the cities, which I think has to be done first before you bring this back to us. I thought that's what was going to happen. I will take full responsibility for misunderstanding what was communicated. But everybody here knows that the cities and the county have issues, and there's trust issues. And we are being asked to, I literally do not understand this simple question, if anyone can answer it. We're being asked to approve a methodology and a phase-in period, and then go negotiate. I have no clue what you're going to negotiate. And what the city managers have asked for is a 90-day pause. And if you read their letter, they want to be good partners. They want to review this. They might have suggestions about a different methodology that might be workable. They don't know yet because they've gotten this at the last minute. So I'm a no on this particular item. Not because I think this methodology is flawed. It might not be, because I think our process is completely flawed. I think it's backwards. I think we need to be getting them on board, which apparently we have started to do, but getting board approval of the methodology and the phase-in period, and then negotiating, I think is just putting the cart before the horse. Thank you.
Do you want to suggest something else today, David? You're very passionate and obviously well-informed on this issue.
I just think if they've asked for a 90-day period, and we're going to go meet with the individual city managers and representatives, whoever they might be, as was just discussed by Mr. Zervis, I think that's an appropriate thing to go do and to bring this back when that's concluded. In that 90-day period, we may get a new type of methodology. I don't know. Maybe we won't. Maybe we'll have all 11, or it's not 11 cities, all contract cities on board saying this is the best one. But I think our process is backwards.
We have, it sounds to me like you believe we haven't communicated enough to get buy-in and some compromise.
Yeah, well, not even compromise so much as here's our issue, which has been explained to them, and allowing them time to think about it and come up with alternatives if they're acceptable to the county or not, at least allowing them that opportunity. I don't think we've done that.
Okay, thank you, David.
Thank you.
We'll come back to you. Supervisor Gleason.
Thank you, Madam Chair. Appreciate it. First, I want to start off by thanking the fire department
for adhering and understanding the audit, the assessment that was done a couple of years ago, and we're trying to comply with it, and we're trying to find the best way home for the fire department, and we're going to get there. So thank you very much. Second thing I want to talk about a little bit is I've had conversations with the city managers and with mayors about this issue, and this is what I'm coming back with. One is city involvement, buy-in from the city. I mean, the way I read that letter that was authored and sent in, they're on board. They know they got to pay more. They want to pay more. They don't want to pay more. They know they've gotten a good deal and the gravy train's over and things got to change and they need to make adjustments. So I think they're ready to make adjustments. I think what they want is, what I'm hearing them say is they just want some buy-in. They want some time to help them understand what full cost recovery is, because we have a way of determining it and they may have a different way of defining it, and they want to contribute in the conversation of properly defining it so they can accept what full cost recovery is and how do we get there. Because if it's $10 to provide a service and they're only been paying $5, which is in the case of Ridgecrest, I mean, they're pretty close, that's what it is. And they know they got to pay more, but they want to balance it off and spread it so that it makes sense to them and it fits their budget, because the way I read that letter, they're all going to have to go out with revenue generating processes to increase their revenues in order to cover their costs. Mr. Zervis, I got a question for you real quick. The city of Ridgecrest said they have a contract that extends till 2022, yet this one's going to start in 2021. So are we going to change their existing contract and ask them to bail out of that contract early to start this new one sooner? Is that the plan?
Yes. So, and that's the reason that the board is being asked to take action now, is those contracts have, most of them have 12-month notification periods. So being able to give notification and start the negotiation process, which provides for a 12-month period to go through that process and work with the cities and consider those concerns. That's why. So yes, and I think that also addresses some of the issues raised by Supervisor Couch.
Great.
As far as why the timing is structured the way it is.
The 7-year phase-in, I think I heard it was that, so the contract we have it shaped right now, it starts next June, and then I heard you say 1/7 every year for 7 years?
Yeah, so it looks at the difference between the current cost and the calculated cost and divides it by 7, and then just adds 1/7 each year to get it from where it is currently up to what full cost recovery is.
Okay, I think that we are overdue in implementing this full cost recovery model. I think we need to go, and I think we need to get there. And I don't know how we can pass the word full cost recovery, but the city managers seem to think that they want to contribute to it. What is the damage if we were to say, allow I'm fully supportive of this. I want it to go. But I agree with Supervisor Couch in that there's an element of buy-in that's going to make it worthwhile, and it'll give us long-term dividends. Would you talk about that for a second and see if there's some way we can accommodate Mr. Couch in giving a 60-day extension? It was brought up June 30th. We give him 90 days from that point. Talk about that, and is that a possibility?
So
and excuse me for a second. Let me tee it up even a little more acutely for you. The reason I'm asking that question is purely for the advantage of maintaining relationships with the cities and truly getting to a place that they can completely and inarguably understand that they've got to go for a tax increase or they've got to shut other business lines down in order to accommodate their fire needs. Go.
Yes. So Supervisor Gleason, through the chair, the intent was to we have a methodology, obviously, that was conducted. Of course, there's all different kinds of methodologies to get to full cost recovery, although this is a pretty clear one. And there wasn't a lot of argument about that. In fact, there was an initial, there was discussion on our call with the city managers. They would be requesting some additional data. That we we haven't seen that request yet. So in fact, the letter received yesterday was the only communication we've had from the city manager since that call. So there hasn't been any effort from them to move forward with any more analysis. That being said, you know, the issues outlined in their letter deal with questions of wanting to make sure that the fire fund is fiscally stable, or wanting to make sure that it's a fair allocation, I think, in a sense. And we've explained the allocation. There isn't an alternative allocation or effort to move forward in that way. So they're asking for 90 days. We want to get this clock started now. We have a deficit problem now. The longer that it's delayed, and just the more that grows. So what I would suggest, if you, my intent was to work with them and the fire chief to review our methodology if they had further questions, to receive their input and their methodology, and if their methodology came back with something that was more appropriate that we agreed with, we would come back to your board when we have the final contract negotiated and say, hey, in retrospect, here is the final contract that we've negotiated with the cities. But to be able to start that conversation, we are under existing contracts that have extended terms to them, and so you know, it was our intent to you know, clearly show the cities where we were headed with this negotiation and provide that notice. So I think that's clear to them now, based on our conversations and your direction. And I guess if you know, the issue with the delay is that it delays the notice period and it delays the implementation. So if we delay for 60 days, 90 days, it's just 60 or 90 days further before we get to, you know, full cost recovery. So I would suggest, if you're not comfortable with the current methodology and you don't want to approve the methodology, an alternative approach might be to authorize termination of the existing agreements and give direction to come back with new agreements with full cost recovery, with a full cost recovery model, without specifying the methodology.
I'm sorry. I mean absolutely no offense by this,
Sure.
none whatsoever. But Mr. Alsop, I think, what is your perspective on, do you have anything to add to what Mr. Zervis said about the impacts to our general fund if we were to allow a continuance of 45 days, 60 days, or something from the June 30th deadline? What are your thoughts about impacts to our general fund?
Madam Chair, members of the board, Supervisor Gleason, I agree with everything that Mr. Zervis said. Just to make this simple, you know, our recommendation is to get this done as quickly as possible. It's something that was identified not only in the CPSM study, but it was also, you know, we brought in a consultant to do a drill down on this particular issue. They were in agreement with the CPSM recommendation. They had their own recommendations, and so this is about this methodology. This is about getting full cost recovery for the services that we're providing. And any delay is a delay in achieving that. And so our recommendation is to do this. I think Mr. Zervis was trying to provide a, you know, your board simply giving us direction to begin negotiations with the goal of coming back with with contracts that do recover full cost, and you take those up ad hoc as we bring them to you, as you have done in the past. That may be a way to proceed here. I don't know if we're going to be in any different position in 90 days than where we are today. The situation that the cities are highlighting in their effort about finding revenue sources, those are the same issues that I've been dealing with here and your board has been dealing with here before I got here, you know, for many, many years. Our revenue sources are not keeping pace with the costs of providing services, and so We need to either enter into a process where we sit down with these cities, discuss with them how to construct these contracts, phase them in over a period of time. 7 years is a considerable amount of time to phase in and deal with this situation. You know, or we postpone. Your board is certainly in charge here, and whatever you decide today, whether it's to delay 90 days or 45 days or whatever you want, we will do so under your direction. But we are recommending that your board direct us to get started on this today.
Thank you, Mr. Alsop. I wasn't trying to go over your head or undercut your credibility of this topic. I really wasn't. It was just I wanted to know a different perspective.
No offense taken.
Okay,
I understand.
good. Thank you very much. Appreciate it. None intended whatsoever. Okay. So your idea, Mr. Zervis, is that we pass this today, and then you go knocking on the doors, or we're going to get together with city managers and we're going to have conversations to negotiate. Or are we having conversations to impose these terms and these definitions of full cost recovery to these people? Which is it?
It is to move forward with a single methodology so that we can have that discussion. Part of the problem with not having an approved methodology and having these discussions is right now we assume that all the cities are on the same page. These are all independent cities with independent boards, and they may not be. You may have one city that thinks one allocation is fair and another city that thinks a different type of allocation methodology is fair. And that could go across all 9 entities. So although the letter that we received yesterday is united, I don't want to assume that that's going to be the case throughout this process, which is why, as the contract provider, as the service provider, we're really in the position to have a methodology to say, here's what our costs are, and here's what we're going to charge to provide this service. And so to your point, to Supervisor Gleason, it would be to have that methodology approved, be able to go have those discussions with the cities, and be open if in that process over the next year as we negotiate this, other changes or tweaks come up to say, hey, there's a different methodology that everyone agrees makes more sense, and we come back to you before any contract is finalized, obviously, and address it when we have that contract to bring before you.
Thank you, Mr. Service.
Thank you, Supervisor Gleason. Supervisor Scribner.
Thank you, Madam Chair. Mr. Zervis and Mr. Alsop, thank you for your work on this. I know that your objective is to get the fire department on solid financial footing. That's been your objective from the beginning. And I agree that that's an important objective and one that I think that the board shares with you. What I will tell you is if we adopt this methodology and then go and negotiate, I think the optics are, the message there is that we've decided what the methodology is, but now we're going to come around and discuss it with you versus going in and saying, this is the methodology that staff is recommending, having those meetings with those top executives, just like you two are top executives in the county, the top executives at the respective cities, the folks that sent us this letter, the city managers. Our board, we have a shared constituency with these cities. We represent the folks in their cities just like they do, but with a little bit different areas of responsibility. But I think that a lot of these cities, they want to be partners with us. I think that they realize that that the service level that we can provide as the County of Kern County Fire Department is going to be superior for the cost and what they might be able to go out and recreate. That is my feeling. I think that they will find that it would be more expensive for them to try and set up a fire department, et cetera. And so I feel like we will get there, but I think that we need to go in a spirit of partnership versus making a decision on the methodology and then going and have discussions. And so I agree with a lot of what my colleagues have said. They're asking for 90 days. That's October 20. I know that sets our timeline back. as far as when we can start recovering costs. And we are in difficult financial times here at the County of Kern, but the cities are as well. And I think that that is what is driving their trepidation on this, is how this is going to impact them in the face of lost revenues with the COVID situation and the other economic stressors that they were maybe experiencing before, just like we had our own before COVID hit. It's just a financial perfect storm, unfortunately, for everyone. And so I am going to move that we bring this back on October 20th. That, I believe, gives a hard deadline for the conclusion of these discussions on the methodology. They can bring all of their ideas, and then you, our staff, can come back with us with a recommendation based on those discussions versus what we have determined in-house. And I know that we have to be mindful of our fiscal house first and foremost here at the county, but I think that we need to move forward in the spirit of partnership, because it's going to be better, I believe, for all of our constituents if our fire department is providing the service. I don't think they're going to be able to find a better alternative. But I think the way in which we do this is important. And so I'm going to make a motion we bring this back on October 20th, which is 90 days, which is what they request. Thank you.
Thank you. Supervisor Maggard.
Thank you. I appreciate the opportunity to speak about this. With all due respect to my colleagues, I absolutely, adamantly oppose delaying this. 4 times in this letter, these cities make clear their awareness of the financial crisis that we have, the instability of the fire department. They clearly say in the last paragraph, this is not a request for delay. There is no other way to describe their request but to delay. What Mr. Zervis said is crystal clear. Our delaying this decision delays our ability to collect the revenue necessary to stabilize the budget of the fire department. Not only are the citizens of our county throughout Kern County subsidizing the cities, many of whom have known for years that they have this issue. For years they have known that. Not only are they asking citizens all across Kern County to subsidize their operations, but now we are facing the real threat that fire stations in other areas that have nothing to do with their not paying the bill that they owe, other citizens are going to face the prospect of possible brownouts of their fire stations. That is not fair. It's not appropriate for the level of protection that people receive to go down because these guys are trying to delay getting this done. There is nothing that will stop us from negotiating during the 90 days. And I can count, I'm pretty good at counting. I don't think I'm gonna change the direction this is going. But it should be crystal clear that they have a responsibility to pay their way. And if they don't, then they ought to find another alternative. But I refuse to allow the citizens that I represent to be imperiled because they can't get this done. So it better come back in a way that solves it. I've watched carefully this dance that's gone on with the fire department in the last few weeks. This cannot be allowed to go forward. It needs to be dealt with. So I will not, with all due respect to my colleagues, I will not vote to delay this again.
I have.
I'll second the motion.
The fun never ends in Kern County. Mick, I'd like to hear from you again. The reality is, for me, I hear our fire chief supports our CAO. That to me is very clear. Of course, I respect my colleagues with all of our differences. I respect their positions. They have cities and deal with matters that I politically do not deal with. So I want to acknowledge that this is not as complicated for me personally, and therefore I can understand the complicated nature of this issue. So I really want to know where you're at and how you feel about. I hear our CAO and his team as well as the fire chief saying this should be done. I cannot ignore the reality from what Supervisor Maggard has said. This has been pending for years. You and I know that personally. We have attempted to work these relationships out with the cities for a long time. We haven't really taken any major action, and I don't feel terribly hopeful that things will necessarily change in the next 90 days. Because I have often seen the cities as really believing the county can figure it out somehow. And I'm at a place now, observing this board, observing this county for 8 years, where I don't believe that. And I'm very concerned. At the same time, I think the arguments about buy-in from the city are compelling. I think Zach and Dave make very good arguments. So I'd like to know where you're at before we take up the vote on the continuance, because I'm hearing some desperation from my CAO, and my fire chief is saying he supports its efforts. So where are you, Mick? Help me out here.
Okay, I'll give you my opinion. And for what it's worth, I really, really enjoyed listening to Supervisor Maggard. As usual, he's unambiguous and strong in his opinion, and I appreciate it. And it's served well to help me through 8 years of being on this board. So I appreciate what he says. I think the tall pole in the tent on this particular issue is the long-term relationships we have with our incorporated cities. I think managing those, first and foremost, I think full cost recovery is mandatory. We need to get there. We need to get there as soon as we can. I'm going to be fully supportive of full cost recovery. I don't care how they define it, but as quickly as they can define it and get to it, I'm going to support it and support our fire department. I know they've been through hell, and we need to end this. But I think having a relationship with the cities is paramount. I think managing that relationship is going to be a factor for us for years down the road. And I think in the best interest of a long-term solution, I think giving these guys a couple extra days to work through their problems, whether it's 90 days or it's 45 days, I'm okay with it. But at the end of the day, I'm going to support full cost recovery for our fire department. That's my thought.
Okay, Mick, that's very helpful. Thank you. Then I'm going to take up the vote on the continuance. It sounds like a majority of this board supports the continuance. And in the spirit of unity, I'm going to support that effort. And I certainly appreciate the candid dialogue here. These are tough issues. And each of us supervisors has our own realities that we have to manage in the complicated nature of governing. So I have the utmost respect for my colleagues, their positions, and our differences. With that said, I will take up the motion of Supervisor Scrivener, seconded by Supervisor Couch, on the 90 days. Please cast your votes.
The motion is approved, 4 ayes, 1 opposed. Supervisor Maggard.
Okay, moving right along, we are going to get to item number 29, which is a response to the July 14, 2020 referral regarding recommendations on an awareness program related to convalescent plasma donation. This is an exciting topic. I want to profoundly thank Supervisor Maggard for his aggressive approach on the SNFs, on the issues related to our elderly. And I would like to share with the public that I recently had an experience with a relative of mine, a first cousin, who spent 5 days in the hospital with corona. And she is a person with a very serious pre-existing condition of which she is undergoing chemotherapy for, and indicated to me that corona was worse than the therapy that she had been receiving prior for a very serious matter. And that was quite stunning to me. But after several days, she did receive some plasma, immediately began to feel better, and ultimately was released from the hospital and is recovering at home. And I am very excited, Mike, that plasma route gives us an opportunity for action, something to coalesce around as a community, and gives us a chance to fight back in this war effort, if you will. So thank you for your leadership on that. I'm excited about this presentation, and I'm all in to do my part in the collection and the care of our neighbors in this community. So with that said, under Public Health Services, Mr. Constantine, I see Mr. Constantine has left, And we have Bryn here. Thank you for your hard work and expertise, and we're looking forward to hearing from you.
Good morning, Madam Chair and members of the board. Bryn Kerrigan, your Assistant Director for Kern County Public Health. On July 14th, Supervisor Maggard requested the department return with a plan to raise awareness of convalescent plasma donation in Kern County. Convalescent plasma is the liquid part of your blood that is collected from patients who have fully recovered from COVID-19. COVID-19 patients develop antibodies or proteins in the blood that help them fight off infection from the virus. There is no proven treatment for COVID-19. However, there is some information that suggests convalescent plasma may help some patients recover faster from COVID-19. It is generally very safe to donate blood plasma. Houchin Community Blood Bank is the only known donation site in Kern County, and they are low on convalescent plasma donations. A single donation of plasma could help up to 4 people. All donations received to date in Kern County have been used within Kern County hospitals. The department has launched a social media campaign raising awareness of the need for donations here locally. Ms. Krause, if you can turn the document reader on. This post was shared on Kern County Public Health's Facebook, Instagram, and Twitter accounts in both English and Spanish. The department has also added a section on our COVID website related to convalescent plasma, linking interested donors with Houchin Community Blood Bank. The department mails around 3,000 letters per month to COVID-19 patients. Many of these letters are sent to those who have been deemed released from isolation or whom have recovered. The department has added a flyer to these mailings with information related to donating convalescent plasma. The flyer looks very similar to our social media post. Houchin Community Blood Bank has established a COVID hotline for our community to utilize. The phone number for their hotline is 661-616-2575. I want to thank Supervisor Maggard for the nudge for us to raise awareness to this important cause in Kern County. Also, I believe representatives from Houchin Community Blood Bank are on the line should your board have any questions for Houchin at this time. Madam Chair and members of the board, that concludes my presentation. I'm available for any questions you may have.
Thank you. How effective has your letter campaign been?
Madam Chair, I would have to ask if Houchin representatives on the phone are able to tell us if they've had any recovered patients reach out to them since our campaign a couple of weeks ago.
Wonderful. Is a representative from Houchin on the phone? Are they maybe on and muted, Kathy?
I think they're unmuting their phones right now. Here we go.
Okay. This is Josie Pippert. We have seen a couple letters come through when they come to donate. A lot of them, probably most of them were from the state. I don't know if I've seen any local Kern County letters come through.
Oh, wow. And do you have any, you're Josie Pippert, is that correct?
It's Pippert.
Excuse me, forgive me, Pippert.
That's okay.
Thank you, Josie. Pippert, for the record, Josie with an S.
Correct.
What sense do you have about what is motivating people with a state letter or a local letter to come in and take this action?
Sometimes it's knowing someone that's already in the hospital that is already sick with the COVID-19 virus. We get motivated with that. People come in with that motivation. A lot of it is they just know that they've had the virus and they want to help.
How many people would you say fit that category?
Well, I would say probably the majority of the people.
Can you give us?
You know, they get confused with the regular plasma centers that will pay people for the plasma, and that plasma product does not go to a patient. It goes to a pharmaceutical company.
the plasma for pay, if you will.
Yeah, I think they get confused between that plasma and what we collect here.
Okay, so there's some, that makes sense. Okay. Is there a way to pay people for their plasma, the convalescent plasma in this instance for treatment? Is that legal, ethical? Can we do that? Because I think it works very well in the other plasma arena. I know lots of people in my district that participate in that opportunity.
Yeah, they do really well, but no, the guidelines from the FDA are pretty strict about having it be labeled as a volunteer donor as opposed to a paid donor. We do offer incentive to the donors, maybe a chance in a drawing for some gift cards. That's what we have going on right now.
It seems to me like we need a sophisticated effort to motivate people to be involved and to come out and, you know, make a personal sacrifice that clearly puts them in danger of either getting the infection again or just the stress of going out and dealing with, you know, these rather complicated times. What is your sense?
We started our own, we've done our own advertising on social media, reached out. The news stations have had information about the COVID plasma, reaching out to patients, and then the help with the county and the state also. And we seem to be getting more and more donors. This week, we're trying to push to get as many COVID recovered patients in as possible because we just can't keep up with the hospital orders. We can't fill them.
Wow. How behind would you say you are?
I believe there's probably 20 orders. I think I heard that this morning. 20 orders of the plasma. And as soon as we have plasma, you know, tested and released, available to be shipped out, it goes. It gets shipped out to our local hospitals.
How many people equates to 20 orders? Earlier, we heard that one person can donate and it can help up to 4 people. So what does 20 orders mean?
Probably 20 patients.
20 patients. And that can serve up to 4 times that, 80 people, potentially.
Well, if we had 20 donors, let's say, and they each could give, you can give up to 5 if your body, you know, will let you give that much. We have it all plugged into the machine, but on an average, let's say 4. So I would need 5 patients for those 20 orders.
I see.
Or 5 donors, sorry, for those 20 orders.
I see. Assuming that they could give that much.
Right.
Do you have a mobile capacity the way you do with blood collection?
We do. We are able to get that set up and send it out, yes.
Very good. Very good. Thank you, Josie. I know my colleagues have questions, and I'm going to move to Supervisor Maggard now, who has some questions for you. Supervisor?
Thank you, Madam Chair, for the opportunity to speak to this issue. I want to thank Public Health for your responsiveness and jumping on this, as well as Mr. Alsop for your willingness to help us get this up on its feet and going. I have a couple questions for Ms. Pippert from Houchin. Ms. Pippert, are you still available?
Yes, I'm here.
Thank you, ma'am. I appreciate you letting me engage you in a conversation for a moment. You said there are 20 orders pending for convalescent plasma. How much do you have on hand, and how many of those 20 orders can you currently meet?
I think we are completely out of convalescent plasma. A lot of times they want type specific or ABO specific. So some of it is that problem. Like if they're looking for A plasma and say we only have type O, then, you know, it's up to the doctor if they want to switch that blood type, but generally they try to keep it in the same blood type. So specific numbers I don't have for you at the moment, but in most cases that's what it is if it's type specific and we just don't have it.
I've given blood many times. I've never given plasma, so I'm not familiar with plasma donations. Are they as specific as our blood types when you're given a blood donation? So I was O positive. I am O positive. So there was a constant demand. That's the universal donors, I recollect. There's a big demand for my type blood. But is it the same for what I'm trying to get to is, does it make it more difficult to supply this because the plasma has to be blood type specific?
Yes, in some cases. The RH factor, the positive, negative, doesn't really matter. It's just the ABO type.
Okay, so O positive, O negative doesn't matter as long as it's type O.
Yes, correct.
Okay, thank you. Back in the day when I used to do this regularly, I would receive phone calls. Boy, it seemed like every month I'd get another phone call at work, saying, hey, we're in need of your type. Can you come down here? How actively, aggressively are you still having to recruit people to give blood, not plasma, but blood?
We are always actively recruiting. Yes, we have phone calls every day. We make them every day to get people in here to donate blood, platelets, and plasma.
And would you say that when you initiate those efforts and you make those calls, you get a substantial, a dramatic response?
I would say for the most part, yes, people are responsive. Different times of the year are different responses that we get. Summer's a little tight because of vacations. This summer's a little different, but things, it's seasonal and it's just different, but it's a constant recruiting process that we do all the time.
Thank you. That's my understanding. That's the case throughout the country, that the results we get are because there's a very vigorous, aggressive effort for that. So one last question for you, Ms. Pippert. How do you, well, I guess I have two questions. How do you obtain the list of those people whom you contact to ask them to donate blood?
How do we have the list? It's
where do you get the names and numbers?
How do we get the names?
From where do you get the names and numbers of those you call?
Oh, that's in our database, and these are all past donors, or I should say, they have donated with us at one time or another. That's who we recruit over and over again.
Thank you. Thank you for that. I'm going to ask you one more question, and it pertains to an issue that we are facing here, and that is I'm being told that there are restrictions on our ability to share with you the names and numbers of those people who have tested positive and recovered and therefore might be able to donate convalescent plasma. I'll deal with in a second here on my end how we go about getting that information. But if we were to be able to give you that information, could you assist us through the mechanism that you currently have when you contact blood donors? Could you assist us in increasing the effectiveness of our recruitment of people by helping us with those contacts if we were able to get you that information?
Oh, yes, definitely.
Thank you, Ms. Pippert. I appreciate your help with that. So I'm going to pivot now and talk to us about the frustration that I have here. But it seems like I'm frustrated all the time. I guess that's the COVID world we live in. I'm sorry that my colleagues have to tolerate my frustrations from time to time. But the issue, as I understand it, is that HIPAA laws appear to be inhibiting our ability to be able to recruit other people to make contact for us. Ms. Raison, could you give us a little synopsis of where we are with that?
Supervisor Maggard, through the chair, that is correct. There are a number of legal barriers for the county or health officer in particular to provide information that's known as protected health information, the identity and contact information of individuals. As the health officer, he obtains information in this instance, specifically the name and identity of people who have tested positive for COVID-19. However, The law does not allow him to provide that information to a third party, such as Houchin Blood Bank, without express authorization from the patient. There are federal and state laws that would make doing so a breach and would subject the county to fines and penalties. There's a way of going forward that I know we discussed briefly, that coming up with a program so that people who now test, perhaps at the time that they take the test, they are provided an authorization form that they could indicate that it would be okay for their information to be provided for the specific purpose of being contacted regarding a possible plasma donation. And if that were to be arranged, then, like I said, going forward, that would be a solution. But providing information to providing private health information or protected health information of people who have not signed that authorization to Houchin at this time is problematic.
Thank you. So if we were to find another department or other county employees, since it's county information, can county employees make these phone calls?
If those county employees, again, one of the ideas that we have discussed is temporarily loaning county employees that work for different departments that perhaps the employee, due to COVID-19 and just other reduced workloads, might have time that they could devote to doing additional work or different work. If those employees were temporarily loaned to the Public Health Department and received training on HIPAA provisions and confidentiality, then under the umbrella of the public health officer, calls could be made.
Thank you. It is the law as it exists is not your fault. I hold you not responsible at all for the news that you give me oftentimes that I don't like, but it is not your fault. I acknowledge that, and I appreciate your willingness to work with me on how to figure these things out. But I just want to emphasize this because I want to push us to get, I want us to make direct phone calls to those patients who have survived COVID, and I want us to solicit of them directly how to do that. Ms. Kerrigan, sorry, I lost our last name for a second, Bren. Ms. Kerrigan, can you give us any idea of how active the state's direct contact of people soliciting their donation is? How active are they in Kern County?
Supervisor Maggard, through the chair, we're only aware of one letter that was sent out a few weeks ago to those patients that had tested positive, and that was a statewide effort.
Okay. So I like the idea of prospectively, when someone has a test done, they sign a piece of paper that acknowledges that those test results might be used to help us solicit convalescent plasma donations. I like that idea. I'd like to pursue that. But I also want us to be more creative about how we can solicit those people directly. Public Health, Matt Constantine and Bryn Kerrigan, frankly, have their hands full. They are, I know because I correspond with them and I talk with them in the middle of the night, 7 days a week, early in the morning, late at night. I know that their correspondences to me sometimes are in the middle of the night, 3 o'clock in the morning. These people are working constantly. I don't want to give them another responsibility. I want the county to find another way to get this done. But did you catch that there are 20 pending requests? There are 20 lives at stake, and Houchin doesn't have a single unit of convalescent plasma to give them. 20 people's lives are at risk, and we are struggling with how to find a way to be more aggressive in soliciting those people. I want us to, I'm saying that because I want us to have that sense of urgency that there are families and individuals whose lives are at stake while we try to figure out how to solicit them. So I'm going to ask the CAO to find CARES Act dollars, the $57 million we just got from the state and the governor. Thank you for that. Those dollars, we have 8,000 employees, many of which are not at work every day now. There must be some way that we can put together a team of people that can, whether it's contracting Houchin to work on our behalf, I don't know why that wouldn't work, or directly assigning our in-house employees to do this. There must be a way for us to do that effectively, and we should not sleep tonight until we have concluded what the response is, because 20 people's lives are at stake for that. So I hope we are, there is nothing more vigilant to us this afternoon than solving that problem. And I would love to hear my colleagues' responses. Thank you to Ms. Pippert for her information this morning, as well as Margot and Ms. Kerrigan. Thank you.
Supervisor Maggard, thank you for the urgency of that message. I think it is spot on. My office has a long relationship with Houchin. We do regular blood drives with them. I really think it's incumbent on us to step up our game here dramatically, and I would love to be part of that process. I know Supervisor Maggard's taking the lead, so I don't want to step on his toes, but I want to offer our expertise because we've done this now for several years. We've been able to entice folks in a legal and ethical way that makes the process enjoyable and pleasant and incentivizes behavior similar to marketing. So I want to really be active in that process and assist you, Supervisor Maggard, in to me, what is such a simple way for us to make a life or death impact on people's lives during Corona and give people something to do in this effort. On the front lines. I think people want to help and don't exactly have the direction on how to do it. There's letters from us and the state, and I can't imagine that that's a coordinated and clear effort. No fault of yours, but that's what we're in. A once-in-a-century pandemic clearly offers many opportunities for confusion and chaos, and I think we can provide a lot of clarity to the public. And so I want to be real aggressive about this. Supervisor Gleason?
I'm sold. So how do we do this, Mr. Alsop?
Supervisor Gleason, through the chair, I think we just do it. To just put it simply, there is a host of efforts underway. I want to quickly go over those. I mean, Houchin themselves are doing some communication and work on this. Giving them some authorization to make calls in addition through this process of prospectively going forward, getting permission, I think is a value-added thing for Houchin, and we'll work on that. You know, the city, county, medical community communication campaign that I spoke about a little bit earlier will incorporate convalescent plasma messaging and directing people to donate and give to Houchin. Obviously, Ms. Kerrigan hit on the state and their statewide effort through letters and such. I did have and so one question to Ms. Kerrigan before pursuing, and I think what we want to do is provide some sort of an effort on some follow back phone calls, phone contacts for those who have tested positive, and that's what we'll be working on post haste, after the meeting's over today. There are some contacts that are made through tracers, and I'm not quite sure what the timing is and when that happens, but so public health, they are making calls at some point. Once somebody is determined to be positive, I would, in addition to pursuing the effort of these follow-back calls, if it's not already being done, ask that we load in to those touch points some messaging on convalescent plasma, that and those things I mentioned before, in addition to putting together a county team to do some follow-back calls, I think will be something that we can manage and worthwhile.
Supervisor Maggard, that's good.
Thank you, Supervisor Gleason. Appreciate your support. Mr. Alsop, as indicated today, we have the opportunity for surge capacity at at the fairgrounds, which our congressman has provided. It's unprecedented and very exciting opportunity. It does remove me from the equation and my team, which is how it goes sometimes. I would love to pivot and devote my team that is remarkably successful in this process. We've had the top site really in the state for this operation, and we are quite proud of that. But I would really like to aggressively pivot to the plasma donations. Mike, if we could work in conjunction on that, I think so many people are in our years in my district, I think, concentrated. And I would just love a joint effort to aggressively drive for plasma. And I'll tell you, Mike, I shared this story with you privately. You know, I followed hour by hour the experience of my first cousin as she went through the process, and of course was in the hospital 3 days before she could get plasma. And this was not Kern Medical. This was one of our private institutions, and God bless their hard work. But certainly the indication that this was worse than breast cancer treatment is just harrowing to me. And it's the first real intimate look that I've had at what the experience is like on the recipient side. And it just seems that we can be so helpful to the larger effort by joining forces, Mike, and being aggressive, creative. I have some ideas that I'd like to float by you, Mike, as we think about how we aggressively pursue plasma and give people an opportunity to do something, to join this effort on the front lines and help us help our neighbors. So I'm really excited about this. I'm all in. We've now are available in a way we hadn't been, which, maybe that's what was supposed to happen. I have to see it that way. So I want to work with you, Ryan, and of course Supervisor Maggard, as our districts I think are most implicated, and really work to help our neighbors and ease the stress from our healthcare professionals who are inundated by people that they frankly can't help very much because there isn't a treatment and we're not at a vaccine. And that really limits their options and I think adds trauma to the process. Your thoughts, Ryan? And I'm sorry, Supervisor Gleason, are you punched back in? Supervisor Maggard, you done?
I have one more.
Please.
Thank you. I appreciate the support of my colleagues. Anything we can do to help is helpful. So I'm grateful for anybody and everybody's help and look forward to us solving this. So, Mr. Alsop, when do you think you can come back to us with an idea of how we can employ other county resources to start these follow-up phone calls and the solicitation of these donations? I'd love to see if we can, by tomorrow, have filled these 20
I love that.
plasma requests, convalescent plasma requests, because the clock is literally ticking on those 20 lives.
Yeah, Supervisor, again, through the chair, I will commit to getting this done. As quickly as today. We'll report back to your board officially in open session at the next meeting, which I believe is August 4th, next week. So next week, we'll report on this particular item and where we are. But I want you to know that following today, we will be working on squaring away a team and a process for follow-back calls.
Thank you very, very much. I appreciate you colleagues for your passion for this.
I would love to learn more about that.
Madam Chair?
I'm sorry, Supervisor Couch.
I have a question. Your health mobile, whatever I don't know what you call the thing, that you're taking out to do testing for farm workers specifically, are you able to either accept blood donations or in this case plasma donations in that vehicle? And I don't know what it takes to do that.
Supervisor Couch, through the chair, I'm not an expert on what it takes to receive a blood donation or a convalescent plasma donation or a plasma donation in general. So I'm not sure if the vehicle that's being used, which we're contracting out for that, would be capable of accepting that type of donation.
I don't want to overcomplicate things, but could you check with the blood bank to see if they would be interested in partnering up? I mean, we're going out to where we're testing them, but we're also going out where people have been positive.
Absolutely.
So there's an opportunity there. Thank you.
Excellent thinking. Thank you, Supervisor Couch. Anyone else before are we voting here? No. Okay. Public input? Kathy Kraus?
No, we don't have any additional public input.
Okay. Well, it looks like we've come to the end of this item. I want to thank you, and I want to pledge to you mine and my team's aggressive, full, and unwavering support, along with Supervisor Magritt's staff, who works very well with mine, to pursue the creative plasma contributions. We have some ideas I think are fun and community building. I think people are looking for those opportunities, and I want to have some fun with this, and I think we can build even closer neighborly relationships through this process, and I'm excited about it. I think it's a privilege. So let's please move aggressively. I think the statement said the clock is literally ticking. It is a serious matter, and it's something we can do right here, right now for our neighbors. I believe it's better to give than to receive. I sincerely believe that. So here we are. Thank you. We'll be in touch. And I believe brings us to closed session. We're going to consider items 55 and 56. Supervisor Couch, in addition to having the first mobile unit in the Central Valley, you make a motion to adjourn. See you at 2.